Bore da, a chroeso cynnes iawn i bob un ohonoch chi i'r cyfarfod heddiw, sef cyfarfod Bwrdd Iechyd Addysgol Powys. Hyfryd ydy cael cwmni pob un yn y cyfarfod a phob un sydd yn gwylio y cyfarfod p'un yn fyw neu fel recordiad ar ôl y digwyddiad heddiw. It's good to be able to welcome each and every one of you again to this meeting of Powys Teaching Health Board, held, as we're all aware, virtually, and there will be a recording of the meeting available on our website after today's meeting. I'm Carl Cooper ydy'n enw I, a fi ydy cadeirydd y bwrdd. Ac wrth i ni fynd trwy y cyfarfod heddiw, fe welwch chi ar eich sgrin enwau o aelodau'r bwrdd i chi gael gwybod pwy yn union sydd yn cyfrannu at y cyfarfod ac at y trafodaeth. Mae'r bwrdd yn cynnwys aelodau annibynnol ac aelodau gweithredol, a gyda'n gilydd, dyn ni yn cydweithio mwyn cyflawni ein cyfrifoldebau fel bwrdd. As we go through our meeting, the names of board members and participants will appear on your screen so that you can see who is contributing. And you'll see that as a board, we consist of independent members and of executive members, and our responsibility is to work together as a unitary board to fulfill the responsibilities placed upon us. And so, and also on your screen, you will see a list of apologies of those members that aren't able to be with us today. I'm sorry that we need to begin our meeting today with some sad news and on a sad note. Since our last meeting, one of our colleagues, Mark Taylor, who was the independent member and had a portfolio responsibility for estates, has died. Mark was a very dear, valued and respected board member, colleague and friend. His contribution to the organisation generally and to our work as a board and our governance responsibilities will always be greatly appreciated and valued. We will miss him very, very much. And we simply want to take this opportunity to express our thanks and appreciation for the pleasure, privilege and honour of having known him and having worked with him. We've had opportunity to speak with his wife and family and to be with them and to assure them of our condolences and of our appreciation of Mark. So following that sad note, we go on now to consider this meeting, and I just want to explain very briefly what our responsibilities are as a board. A bwrdd ydy corff llywodraethol y sefydliad, sef Bwrdd Iechyd Addysgu Powys, ac ein cyfrifoldeb ni ydy gosod cyfeiriad strategol ar gyfer y sefydliad, gosod archwaith risg o ran cyflawni ein hamcanion strategol, ac hefyd, ac yn bwysig, monitro perfformiad y sefydliad yn erbyn yr amcanion strategol hyn. Our responsibilities as a board are to set strategic direction, to set the risk appetite in the delivery of our strategic aims, and to monitor delivery and performance against those strategic aims. And I certainly hope that as we go through our meeting, that you will see that we not only take those responsibilities seriously, but we do our very best to fulfill those responsibilities effectively. You may see that sometimes we look away from the screen during the meeting. That doesn't mean that we're distracted or that we've lost interest. It's just that some of us are working off multiple screens, and we may well look to the side or look in a different direction in order to access information or to look at a particular paper that's being discussed at that time. And during the meeting, we have a long meeting today. We will be taking a couple of breaks. One, a comfort break at just before 11:30, and then we will take a lunch break at just after 1 o'clock. Ac felly, fe symudwn ni ymlaen rwan at yr agenda ei hunan, ac fe welwch chi yr agenda ynghyd â'r papurau ar gyfer y cyfarfod hwn ar ein gwefan. The agenda and papers for today's meeting have been published on our website and can be accessed there. So please do visit our website if you'd like to follow the proceedings and look at the papers. So we go now to item 1.2 of the agenda and declarations of interest. We have one item on the agenda which deals with the closure of the branch surgery in Gilwern, and some of our colleagues have already declared an interest in previous meetings in relation to that item, namely Ronnie Alexander, Dr. Kate Wright and Katie Blackburn. We will take those declared interests as read in this meeting, which means that Ronnie and Kate will not need to leave the meeting, but won't participate in that discussion. Katie, as Regional Director of Llais, won't contribute from a personal perspective, but may well want to contribute to articulate the perspective of Llais. Are there any other declarations of interest? Unrhyw ddatganiad o fuddiannau eraill? No? In which case, we go on to an important item on our agenda, which is why we take it first, which is listening. Listening to people, listening to all of our stakeholders. And so we go firstly to a patient experience story, which is going to be introduced by Claire Roche, our Director of Nursing and Midwifery. Thank you, Claire.
Bore da, diolch. Thank you, Chair. Good morning, everybody. I'm really pleased this morning to be able to present a patient story, which is going to be presented by our Assistant Director of Nursing for Quality and Safety, Zoe Ashman. This is Lynn's story. Lynn is not the patient's real name, but we're going to refer to the patient as Lynn. And this is a story which tells of this person's experience while at our one of our community wards in Welshpool. It's really important as we hear this story to remember that this is the experience of an individual and really highlights what mattered to them at a really critical and important time in their life. The story is quite critical of our services, and we need to not be able to shy away from that feedback that we have, as that is a gift for us as a health board to be able to understand where we need to improve and how the experience of the people who use our services is probably the most important piece of information that we can receive. It's really important to explain that any story that we hear, any experience that we have from people who use our services are shared with those teams that give those services, so they can consider that experience of the individual and that it really impacts on improvement for our teams. It's also really important to note that patient experience is monitored through our Patient Experience and Quality Committee, where we take a variety of experiences through to our committee, and we use our themes and trends of those experiences to be able to improve our learning. And finally, really important for us as a board to be able to listen to the experiences of people who use our services, as they will impact really positively on our decision making that we make, so that actually we were always considering the needs and the views of our citizens in those decisions that we take in being a listening board. So I'm going to hand over to Zoe now, who is going to take us through and explain to us the story of Lynn. Thank you, Zoe.
Diolch yn fawr. Thank you very much. I'm presenting the story in Welsh today, and it'll be on the screen for you in both Welsh and English. So I will begin. Fy mhrofiad cyntaf fel claf ar y ward hon oedd ym mis Ebrill 2021, yn fuan ar ôl y dychwelyd adref, datblygais boen difrifol yn fy mhenglin. O bosibl trwy wthio ffram Zimmer dros y garped gosod. Cefais gyngor i ffonio 111 a awgrymodd fy mod yn mynychu'r adran achosion brys yn ysbyty Ymwythig. Ni chafodd unrhyw achos ei nodi dros y boen ac ar ôl tridiau cefais fy'n rhyddhau ysbyty cymunedol ym Mhywys i adfer. Trwy gydol fy arhosiad ym Mhywys, am bron 3 wythnos, dywedais wrth y staff am y boen ym mhenglin dde a aeth yn waith yn raddol. Doeddwn i ddim yn gallu rhoi pwysau ar fy nghoes dde a roedd yn cerdded gyda fy mhenglin wedi troi mewn ac yn pen draw gyda fy ffêr bron yn llawr. Dwi ddim yn meddwl roedd y staff yn credu pa mor boenus oedd i mi, na i fod yn boen oherwydd fy llawdriniaeth diweddar ar yr un penglin. Dywediodd ffisiotherapidd fy mod yn mynd yn rhy annibynnol i fod yn yr ysbyty, a doeddwn i ddim yn fynd adref. Dwi'n cofio syfrdanu'n llwyr oherwydd yr ysbyty oedd lle olaf roeddwn i eisiau bod. Wrth i'm hoen weithygu, gofais sawl gwaith i gael i weld meddyg neu ffisiotherapidd, ond hytrach daeth nyrs iechyd meddwl i weld fi. Pan ofynnais iddo pam doedd ef, atebodd fod rhai o'r staff yn meddwl fy mod wedi mynd yn orbryderus. Dywedais, os ydw i'n ymddangos yn orbryderus, mae hynny oherwydd fy mod mewn cymaint o boen. Gofynnodd a oeddwn i wedi derbyn unrhyw driniaeth seiciatrig. Dywedodd wrtho fy mod i wedi derbyn counsellor ar ôl fy ngŵr farw, ond meddwl bod hynny'n digwydd yn aml ar ôl profedigaeth. Roedd y digwyddiadau hwn fel petai'n cryfhau agwedd ferniadol llawer o'r staff, bod fy problemau yn fwy meddwl, nid fy nghorff. Cymerodd ymwelydd anfeddygol ychydig funudau i sylw faint o boen oeddwn i mewn, a pha mor wael roeddwn i'n cerdded. Fe wnaeth hi fy mhperswadio i siarad gyda nyrs, a oedd yn deall yn well na llawer o'r nyrsys eraill, a trwy'r hwn fel wnaeth meddyg ymweld â mi yn y bore. Wnaeth o ddim fy archwilio i, ond dywedodd bod poen ym mhenglin yn aml yn deithio o problemau glin, ac fe drefnodd i mi gael sgan Pelider X drwy diwrnod wedyn. Yn hwyrach, y diwrnod hwnnw pan oeddwn yn gartref, dywedodd meddwl arall wrtha i fynd mod i wedi torri asgwrn o ffordd o distal a byddai'n cynnig torri esgyrn yn fy amwythig yn fy weld i mewn tridiau. Cefais bres wedi gosod a dysgais wedyn i gallai fod angen i mi wisgo'r un trwy'r amser oherwydd gallai'r anffurfiad falgus, achos i mi penglin gwmpo hebddo. Pe bawb i wedi cael y bres 2 neu 4 wythnos ynghynt, efallai na fyddai'n anffurfio wedi cael ei farcio mor amlwg, ac efallai byddai fy nodol wedi bod yn wahanol iawn. Mae fy mhenglin dal yn boenus, a byddaf bob amser yn angen rhywun arall i roi fy mhres ymlaen a'i dynnu i ffwrdd. Efallai y bydd angen bres ar fy ffêr a llawdriniaeth bellaf arnaf. Rwy'n credu efallai bod angen am ymagwedd wahanol ar y dealltwriaeth a'r disgrifiad o boen. Ar wahanol adegau, gofynnodd y nyrsys i mi raddio fy lefel o boen rhwng 1 a 10, lle mae 10 yw'r poen fwyaf difrifol. Roeddwn i'n meddwl mai 10 oedd dioddef o losgiadau difrifol neu damwain ddinistriol. Gall graddfeydd rhifau fod yn oddrychol iawn ac yn agored i amddehongli. Mae gan bobl wahanol drwythyn poen a hefyd lefelau gynestrwydd. Oes ydyn nhw'n gyflawni canlunio penodol. Onid yw'n fwy priodol gofyn am lefelau poen a raddfa ysgafn, cymedrol, difrifol neu arteithiol, ac yna trafod effaith poen ar fath. Doedd dim bod yn ormod o drafferth i unrhyw un, glanhau'r ac fe wnaeth rhai o'r gyfalwyr helpu gyda hylendid personol. Gwenan oedd y mwyaf gofalgar a chymwysgar. Gan Gwenan, ges i'r unig gynnal yw gawod a'r unig gawod go iawn i olchi fy nghorff am gwallt a gefais yn bron 2 wythnos. Cefais amrwyaeth o feddygiaeth gan gynnwys orymorff i lefelu'r poen pob 4 awr os oedd angen, ond yn aml roedd yn rhaid i mi aros yn llawer hirach. Ar un achlysur roeddwn ni'n crynu oherwydd roeddwn ni mewn siw gymaint o poen. Ar yr 11 o'r Mai, pan oedd ym mhoen yn gweithygu, dywedodd staff wrthaf yn aml i byddwn yn mynd adref yn fuan ac yn gweud i deimlo fy mod i'n cadw'n gwely rhag unrhyw un arall. Trwy gydol y cyfnod hwn, gofynnodd neb sut y byddwn ni'n ymdopi gartref ac oeddwn ni wedi cael gofal digonol. O'r blaen, roedd cwmni gofal lleol yn gwneud 2 ymwelwyr byr yn y dydd, ond roeddwn ni'n gwybod bod angen mwy o amser arna i, ond doeddwn ni ddim yn gallu ei chynnig nes i mi gael fy asesu chytuno a'i gyllid. Ar ben hynny, doedd fy ngofalwr preifat ddim yn gallu helpu oherwydd ei bod yn gwella ar ôl llawdriniaeth ei hun. Roedd mwy o oedi cyn i mi gael adael oherwydd roedd angen gwirio nad oedd gen i unrhyw ymateb niweidiol i'r feddygiaeth sciatica yr oeddwn ni'n chael. Yna, 6 awr, 1 noson, dywedodd aelod o staff wrthai, rwyt ti'n mynd adref yfory? Unwaith eto, gofynnoedd neb sut y byddwn ni'n ymdopi gartref a pha help a gallai fod ei angen arnaf. Roedd oedi pellaf gan fod angen mwy o rhybydd ar y cwmni gofal ac yn y pen draw, fy ngofal preifat yn teimlo ei bod yn gallu delio â phopeth pan oeddwn ni'n dychwelyd adref. Mae annog annibyniaeth yn agwedd bwysig iawn ac adsefydlu ond mae'n rhaid ei wneud ar yr adeg iawn a gyda chymorth a dealltwriaeth priodol. Diolch yn fawr.
Diolch o galon, Zoe. Claire, are there any additional comments that you'd like to make before we move to our staff experience story?
No, thank you, Chair.
Okay, diolch, Zoe. So we move to our staff experience story, and that's going to be introduced by Deborah Wood-Lawson, our Director of Workforce and Organisational Development. Thank you, Deb.
Diolch, bore da, everybody. Delighted to provide an introduction to today's staff experience to public board about the importance of volunteers. I would like to welcome Nigel Maurice, who is supported by Victoria Sharp, who's the Health and Care Volunteer Manager, and in a moment he will describe his experience as a volunteer with the Health Board. Within the Health Board, volunteering truly came to the fore during COVID, when the Health Board saw nearly 500 members of the public making an invaluable contribution to the delivery of mass vaccination programme in the Wayfinder role. We're seeking to increase the number of volunteers we have in the Health Board, which helps provide an insight into longer-term working opportunities for those not in employment, those wishing to make a career change, alongside those wishing to give something back to their local community through this volunteering role. The role of the volunteer is not a replacement for our workforce, but is complementary and enhances the work alongside our staff to deliver the best possible patient care and experience. Nigel will share his volunteering experience, which has now spanned 3 years in 2 different volunteering roles, and shows how through his dedication and commitment he has helped to shape our model of hospital support volunteering going forward. Can I hand over to you now, please, Nigel? Thank you.
Thank you very much. I'm Nigel Morris. I'm currently volunteering as a hospital support volunteer on Llewellyn Ward here at Brontleys Hospital. My background is in mental health nursing. I retired in 2017, and then my first voluntary experience was at the vaccination centre at Llanelwydd, where I worked as one of the Wayfinder marshals. That was a very positive experience, a lot of camaraderie, most enjoyable. It was whilst I was there that I became aware that they were recruiting hospital support volunteers, and that one of the locations was going to be here at Bromptons Hospital. So I put in an application. There was some delay before anything happened, but I think it was in about August of last year that we initially had an induction into the role, and it was explained what was going to be expected of us, and we were introduced to the deputy ward manager of Llewellyn Ward. I actually started working in about October last year, and initially it was something of a rather a mixed experience. Management was very supportive, very enthusiastic, but it quite quickly became evident that some of the other staff were rather puzzled and wary. They didn't really know who this guy was who was wandering around wanting to talk to patients. The role didn't really have any focus to it initially, and although I was directed towards some patients, a lot of the time I was left to just get on with it myself. Now, that wasn't too bad because I had been used to working autonomously. But at the time, my wife was doing some volunteering similarly, and she found that situation didn't suit her and she didn't stay with it. But I found that I was feeling rather isolated. And there was one occasion when a staff nurse who I hadn't met before actually stopped me to find out who I was. I mean, the situation was resolved very amicably, and that staff nurse was subsequently really quite helpful in directing me towards patients that I could offer something to. But it did just indicate that the ward wasn't really quite ready for me. The situation changed dramatically after a meeting that I had with Vicky Sharp and with the management on the ward, where I expressed the fact that I was thinking I might be looking for something else. Now, management at that point changed. The ward manager who had been away was back in place. The deputy ward manager had a greater ward presence, and that was sort of percolating down through the staff. And the most significant aspect of this was that there was one member of staff who had worked in the day hospital at Bromptons prior to it having to close because of COVID restrictions. That member of staff was seconded to the ward, and I think I'm right in saying she was meant to be supernumerary, but as you know, in these sort of situations, she just got absorbed into the staff. It was then decided that they would re-establish her supernumerary status, and that I would work with her and we would try to re-establish activities, exercise, those sort of things on the ward if possible. Now, it was very different for her because, of course, when she had been in the day hospital, she knew who she was going to see. She knew what their level of functioning was, so she could plan. Now on the ward, of course, it's rather different. Everybody's on the ward because they're there because they're not very well. So we have to be very much more flexible. But we have been able to introduce quite a bit more activity and exercise, and just trying to motivate people. And consequently, I have found that from a personal point of view, the situation has changed dramatically. I feel now that I am recognised as a resource that the ward can use, and that, although not actually part of the team, I don't feel anywhere near as isolated. We have plans. We would like to see if we could have another volunteer. Another pair of hands would make a great difference. We want to see if we can use IT more for sort of video exercises. We would like to see if we could incorporate a bit of music into these activities. I mean, I believe that some years ago there was a musical therapist. Now, we're not looking at anything like that. I am a very out of practice piano player myself, but I can thump out a few harp heralds as Christmas approaches. So this is, it's all about trying to increase and develop the patient's experience. And there's one area where I think we can really be quite useful, and this links back a little to my mental health background. A lot of the patients on the ward, of course, are going through a period of transition from being relatively independent to considerably more dependent on support, whether that's a package of care going in or whether it's perhaps going into a residential home. And this triggers anxiety. Now, the ward staff are aware of this, but rarely have time to sit and talk through with patients about this, whereas we do have time. So that is something else I would like to see us offering to patients, helping with that level of anxiety. So we are hoping to move forward. We are hoping to put together a model of best practice. I shall be working with Vicky on that. And that's where we're up to at the moment. And it's certainly from a rather inauspicious start, it's proving very much more positive now. Thank you very much.
Thank you so much. That is heartening and very, very encouraging. As a health board, we've been very keen to see our, probably not the best word to use, but our workforce as comprehensively as possible, and certainly working with the third sector, the voluntary sector and volunteers is very, very much the direction in which we want to travel. And your experience, both the difficulties in your initial days, but how those have been overcome and how things are gradually being improved is very encouraging, and delighted that you're in the role you are. So and thank you for your time joining us this morning, and thank you also for the patient experience story. And just to reiterate Claire's points earlier, although we don't discuss them at length in this board meeting, I just want to reiterate Claire's assurance that we regard these experiences, this information, as gold dust, that we certainly take seriously, and they do impact and have an influence through our Patient Experience Quality and Safety Committee and other ways on the decisions that we take. So diolch o galon am rannu y profiadau hynny. So symudwn ni ymlaen rwan at item 1.4 ar yr agenda. We turn to the updates from various individuals. Initially, my update as chair, and the report has been shared. I'll take it as read, and I don't have any additional comments, but I am happy to respond to any question or enter into conversation about any aspect of the report. I'll just pause for a second or two so that anyone that would like to comment has opportunity to do that. No, so thank you for that. So we move on to the Vice Chair's report and to Kirsty. Any additional comments, Kirsty?
No, Chair, thank you for the introduction. The paper has been circulated and happy to respond to any queries or comments that colleagues will have this morning.
Thank you. Any question or comment for Kirsty on her report? No, so thank you very much, Kirsty. So we go to the Chief Executive's report and to Hayley. Initially, Hayley, any additional comments?
Oh, bore da, everybody. Yes, no, not particularly. Just wanted to draw out 2 points, if that's okay, members. So firstly, just it is a leadership positions in Powys. Really pleased that Steve is now appointed substantively into the Director of Performance and Commissioning role, and huge congratulations to Steve Powell for the Health Board. And also the local authority has made progress, and now Emma Palmer has been appointed as Chief Executive of the local authority in Powys. And really pleased in how we're working together alongside each other to take forward key pieces of work in partnership. So just wanted to highlight those 2 points. There's been so much award activity recently, such an honour and privilege to play a part in celebrating the fantastic practice across the Health Board. Wanted to draw the attention of the board to those amazing events, and please come along if you're able to in terms of that. And then just finally, one piece of information, and I will ask Claire Madsen to come in around giving you some further assurance on this. Unfortunately, we had a food hygiene rating of 1 for Bronlles Hospital, and you know, we clearly as a board, that doesn't reflect the high standards we expect and have in place across all the other sites that we have. But I wanted to give some further assurance today, Claire Madsen, to ask her to come in on the swift actions that we've taken to address the findings within that food hygiene report. So if I could ask Claire just to say a few words, please. Thank you.
Thank you, Claire.
Thank you, Hayley. Yeah, I would just like to assure everyone that we took very swift action when we had that rating. We were very disappointed, and we've very much done everything we can to ensure that all remedial actions are now actually complete. I would like to thank the facilities and estates team for the way they've managed this. They've been really responsive, and they've worked really hard to make sure everything was rectified as soon as possible. So in 20 days, we have completely turned this situation around, and they've really taken on board how important it is that we have a really good, safe environment for our patients, our staff, and everybody else. So we haven't just taken it for granted that all of our other areas are okay. We've instigated checks across the whole of our estate, and we've ensured that the learnings happened across every site that we have within Powys, really reinforcing the importance of this area. Because we've been able to action all of the remedial actions so swiftly, we have been re-inspected again yesterday. So now we're hoping and anticipating that we will have a revised rating next week.
Thank you very much. Hayley, back to you. Anything else you want to say?
Not particularly. I thought it was really important to bring the board completely up to date on that particular matter. And then just there are later reports on the agenda around our enhanced monitoring status and the position financially. But just wanted board members to be aware that we, the collective effort of the organisation, and in particular the leadership team around preparing for our joint executive team meeting with Welsh Government was much appreciated. We did set a really clear position out to Welsh Government, both celebrating progress and achievements that we deliver, but also clearly discussing with Welsh Government the challenges we've got to manage in the year and as we move into planning for future years as well. So nothing further to add, Chair, just happy to take any questions or comments.
Thank you very much, Hayley. So we have a couple of people that want to come in. So I'll go firstly to Simon, please.
Thank you, Chair. It was just on the relationship with Powys County Council, and of course it's such a critical relationship around health and social care and that dynamic, which impacts very much on Powys residents. I just really welcome your report that there's we think a good appointment there and one we're working well with. I think my question was, can we do more, and what might that look like, and how can the board support the work going on to ensure that that relationship is good and productive and helpful to the residents of Powys from our perspective?
Yeah, thank you, Simon. It's such an important question. So the first thing is, I think we're already doing a lot in partnership, but there's more work to be done. And in particular, I think the level of challenge that we'll be discussing later that we're experiencing across the whole of the public sector around the financial pressures means that we really do need to have another look at, are there further opportunities across the public sector footprint in Powys to work more efficiently and more effectively. So just wanted to reassure you, there's a couple of developments. The first one is that we have agreed that we have now in place a regular monthly joint executive team meeting, which is jointly chaired between myself as Chief Executive of the Health Board and the Local Authority Chief Executive, where we've met 3 times, I think, well, maybe 4 so far. So we're setting a very clear work programme around how we can deliver and work more in partnership on the day-to-day. But the key issue is making sure that we get the work that we're doing around the future model. So we've been doing work on the accelerated sustainable model for health and care and how that fits with a sustainable Powys, the work that the local authority are leading. So we've agreed that we're going to have to pull together that narrative and understanding and work in partnership on engaging with the public on those matters as well. I think the level of change we're going to face, Simon, and as a board is substantial as we go forward, and we're going to have to, as part of our giving confidence to the public, be able to demonstrate that we are doing everything that we can locally around the opportunity. So watch this space. I think there'll be further developments, and I think the other issue to say is we're in active discussions at the moment about how we further systematise that board to cabinet discussion as well to help set that direction for further opportunities for the future.
That's great to hear, and thank you very much. I should have introduced myself more fully. I'm Simon Wright, the independent member for universities, but thank you, that's really encouraging.
Thank you, Simon. Ian.
Yes, thank you. Ian Phillips, I'm also an independent member. I just wanted to go back to the food rating. Really good to see the prompt action and the improvement. But the question I guess I have is that it was a shock and surprise for us to receive the rating in the first place. So I wonder, colleagues, if you could say something about the assurance that we won't get into this situation in the future.
Yeah, thank you. If I just start, and then Claire, you may want to add further detail on this, but the first thing to say is that how we responded to this, and I think Claire, you mentioned it, I'm very pleased around the response of the teams. I met with members of the teams when we were first notified around the situation. And taking a learning approach to this is really important. But that question around, have we got the right quality assurance systems in place day to day to make sure that we are picking up these actions more proactively as a health board? There is some further work being undertaken right now, Ian, to make sure that that's on a more systematic basis, rather than waiting for external food hygiene rating audits to come through. So perhaps Claire, you might want to just give a little bit of assurance to Ian about the additional work that's being done, layering in that internal quality assurance system to make sure we don't have any of these shocks going forward, Ian.
Yeah, happy to come in there, Hayley. I think there were 2 issues we had. One is part of our estate issue. It's a very old estate here in Bronclis, and some of the problem we had was around the estate, and we've done some work with estates to look and make sure that doesn't happen again. So that was part of the issue, and part of the issue was human error, and we will always potentially have an issue where that happens. And I think what's really important then is how we learn from that and how we make sure it doesn't happen again. So we have learned from that, and the checks and balances that we've put in place, we've instigated across the whole site, because we can't be complacent and assume that just because we've had a 5 rating somewhere, we have everything in place. So we are very cognizant of the fact we have to tighten our assessment criteria, and the supervisors in each area have reviewed all of their supervisory roles, and we've tightened everything up, and we have a roaming independent assessment process in there as well now to ensure that we are consistent in our assessment every week. There's daily checks they're double checked. We have done belt and braces now.
Thank you.
And Ronnie, would you like to come in, please?
Thank you. Ronnie Alexander, also an independent member. I have two issues to raise, one of which, unsurprisingly, will be the food hygiene rating issue. I think it's really important that we say that as an organisation, we work collaboratively with regulatory organisations to achieve the highest possible standards of public protection, and that comes across very clearly in terms of the actions that have been taken. And it seems from the explanation which has been provided here that this was partly an issue of structure and partly an issue of practice. And it's good to hear that there's now enhanced monitoring in all of the other kitchens as well. I think we should do everything we can to achieve a consistent 5 rating in terms of food hygiene, because that is the gold standard, and that's what we should always seek to achieve whenever possible. Thank you. My second point is, Hayley, just slightly concerned about the statistics that I'm seeing on measles at the moment. When I looked at BMJ last weekend, there was a report from the Health Security Agency that the number of active measles cases at the moment is equivalent to the total number of cases that there were for the last calendar year. So I just wanted to be assured, please, that as an organisation, we are across that in terms of public health significance. Thank you.
Yeah, thank you, Ronnie. Two really important questions. Just on your first comment, the standard and our expectation is to achieve the highest standard, and we will make sure that we bring back to the board and committees the relevant assurance detail on both the content of the food hygiene report and also the actions that we're taking to maintain that standard. Completely agree with that first point. On the second point, I would ask Mez, our Director of Public Health, to come in and respond. Thank you.
Okay. Diolch, Hayley, bore da, Mr. Bowley, Director of Public Health. Thank you, Ronnie. Absolutely important point around measles. There are a number of outbreaks of measles across sort of England and Wales currently, and you would have seen in the news that is an outbreak in Cardiff currently as well, where there's an IMT managing that. But also in Powys, you know, we do have the border as well, and we are aware of pockets of outbreaks as well across the border. So in terms of local action, we have undertaken a catch-up campaign over the summer where we wrote out to parents of 4 to 16-year-olds that we had recorded as under-vaccinated, and we had a good response to that. But work continues, and we're not complacent, and our messaging through primary care and also to parents is that if you are under-vaccinated, please do come forward, and we'll continue to undertake catch-ups and targeted campaigns. Overall, our MMR uptake is quite good in Powys. However, we do need 95% sort of uptake rates across all sort of age groups to prevent outbreaks. Diolch.
Ronnie, would you like to add any additional comment, or are you satisfied with the response?
Thank you, I'm content.
Thank you. I know that Chris wants to come in. Chris, if I could ask, please, that you keep your question as brief as possible, and if we keep the response as brief as possible, so that we have time to give to other items on our agenda. Thank you, Chris.
Thank you, Chair. Yes, Hayley, it's in relation to the Neville Hall minor injuries item, which is on page 5 of your report. It's mentioning that there was a future meeting being held on the 27th of November, and I just wondered whether you had any update on that, because obviously that will have some potential consequences to residents within Powys. Should have introduced myself. I'm Chris Walsh, and I'm an independent member for the local authority.
Thank you, Chris, and thanks for that question. I will have to check on that, Chris, in terms of particular update from that meeting and send out a note. I'm afraid I don't have specific feedback from the meeting on the 27th of November from colleagues that attended, but I'm happy to pick that up as an action to share with board members.
Thank you, and thank you, Hayley, for that report, and thank you for the various responses from yourself and executive colleagues. So item 1.5 now on our agenda, which deals with the reports from our board committees, very important reports. Our board committees do, if you like, the heavy scrutiny lifting on behalf of our board, and very important sources of assurance for us. The chairs of those committees, therefore, are equally important assurance voices for us as a board. And I just want to draw attention to the fact that we have a new element, if you like, or a new dimension in our report today, which is the table on page 3 of the particular report, which summarises and draws our attention to the escalated matters that have been brought to board and the current status of those escalated matters. And you'll see that none of the escalated matters require board attention currently, but it's very important for us to just keep sighted on those issues. So without any further ado, we'll go to the Patient Experience Quality and Safety Committee report, chaired by our Vice Chair, Kirsty. Any additional comments, Kirsty?
Thank you very much, Carl. As you state, the report has been circulated and I will take it as read. But colleagues at the CREPS committee wanted to bring 2 matters to the attention of the board, and these are included in the paper. Namely, the committee was, as always, presented with a very comprehensive and dynamic report from our Chief Pharmacist in her delivery of the Medicines Management Annual Report. The committee noted that there is a huge amount of work being undertaken by the Chief Pharmacist and our pharmacy team. But the report also noted that there are some real constraints on that team. The committee are, of course, aware that there probably isn't a team in the health board that isn't subject to some form of constraint. But there was concern expressed by members of the committee about the pressure that is currently facing that team and the work that is being hampered, partly because of recruitment issues, partly because of financial issues, and they would like those brought to the attention of the entire board. Secondly, the committee approved on behalf of the board a board level statement on infection prevention and control. This statement forms part of our compliance with the Code of Practice for the prevention and control of healthcare acquired infections. The statement is there for everybody to see, and the committee passed that unanimously. And I guess, Chair, it's just a question of the board formally also agreeing that board level statement, which shows the seriousness and our intent in tackling this very important issue. Thank you.
Thank you, Kirsty. Before we go to the statement itself, I just wondered, Hayley, whether you had any observation in relation to the resource constraints that the committee has highlighted. What, if anything, is being or can be done about that? But also for us as a board, is this simply for our awareness, or is there something that needs to be an action, as it were, for the board? Hayley?
Yeah, thank you. Thanks, Chair. So firstly, I think that it's important that the board is aware of the continuing need to prioritise and manage our resources within those departments in light of some particular pressures that were highlighted, including some recruitment challenges. So I don't feel there's additional action for the board to pick up, but I think that we should be bringing back progress on the consideration of how we are dealing, therefore, with the prioritisation of the work within the teams in light of the current available capacity. And I don't know, Kate, whether you wanted to comment, but I know there are active discussions taking place at the moment around the medicines management function and priorities, and how what options we've got available to address those. I hope that's okay, Carl, but I do feel it's one that we will need to bring back to the committee at a later date.
Thank you. Kate?
Yeah, thank you. Kate Rice, I'm the Medical Director in Paris. So yeah, I think we really need to acknowledge the really impressive and immense amount of work that the team, the MDT, but you know, the medicines management team is putting in. They are dealing with extraordinary workloads. We've still got the ongoing COVID response, which they've supported throughout. We've got the additional ask of COVID therapies, which is very, very challenging. The antimicrobial work, whilst we don't have a dedicated antimicrobial pharmacist, then I just want to highlight that there's still a huge amount of work going on in the area, and we're watching that very, very carefully. So because that is a concern. I think we're all aware of how important then the medicines management team is, just both in terms of patient safety. They are a really important safety net across our system and a really effective safety net. So in terms of safety and quality, incredibly important in so many ways, but also in terms of our efficiencies and outcomes, then the management of medicines in terms of making sure patients are on the best medicine for their condition, and in terms of making sure we are getting the best value out of our medicines, really more important now than ever. So I think we do need to acknowledge there's a huge amount of pressure on the team. They are being supported, and I think what we're doing is really trying to look at what they're doing to see how we can support, and importantly what we will need to do to keep all of these really, really important pieces of work running.
Thank you very much, Kate. So just to summarise, thank you very much, Kirsty committee, for bringing this to our attention. No particular action asked of the board. However, this will continue to be monitored by the committee, and should there be and we as a board will therefore, through the committee, be cited on progress, and should there be further issues, then we will be informed of them. So thank you. And as for the statement on infection prevention and control, the statement is in the paper for our information. I'll assume that all board members approve the adoption of the statement, but please indicate in the chat pane if you don't approve that adoption. Okay, everyone therefore is happy to approve that statement. We move on now. There was a joint committee meeting held between our Patient Experience, Quality and Safety Committee and our Workforce and Culture Committee, chaired by Ian Phillips. And I think this demonstrates how increasingly we are seeking to improve coordination and collaboration between our various committees. This inaugural, if you like, joint committee was chaired by Kirsty. So again, Kirsty, any additional comments as chair?
Thank you, Carl. And as you say, both Ian and I were really delighted to have this meeting. It's been something that we've aspired to for a little while. So we were very pleased to finally get it over the line, and it proved to be a really useful and productive session, bringing those two committees together and recognising that workforce and culture are absolutely primary to the patient experience and the quality of the service that we're able to deliver. As the paper states, we focus very much on the progress of implementing the duty of quality and candour, and also on a draft self-assessment of the Speaking Up Safely programme. There was one matter arising out of the meeting, and that was queries over the role of board champions. Mention was made of the need to have a Speaking Up Safely champion, and this then focused our attentions on what champions are truly meant to do in a board setting. I know, Chair, that this is something that has concerned you and has made you think about for a little while, and I understand is currently subject to discussion in the governance review that the Welsh Health Minister has asked Anne Lloyd, Chair of Nile Bevan Health Board, to undertake in terms of governance arrangements. But the fact that we're going to have a second meeting, I think, is testament to the fact that this first one was a success and everybody thought it was worthwhile. But I'm sure Ian would like to comment also, Chair, if that was possible. Thank you.
Absolutely, please, Ian.
Yeah, thanks, Kirsty, and thanks, Chair. It's something we've discussed for some time. I'm also delighted that we got together. This isn't that we were short of meetings. We just see it really, really important that we make the joins in that important relationship between quality and culture. It was the first meeting. There is more work to be done. Whilst workforce numbers are relatively easy to get to make an assessment, how do you make an assessment of culture? That's a bit more difficult. We have plans in place for that, and our aim is to ensure that we, make some correlation between those quality issues and the cultural assessments. The other thing I think is important to mention here is that we're trying to put a focus in our discussions on not what went wrong and how do we stop it happening again, but a focus on that good practice and areas where we feel things appear to be going particularly well, in order that we can seek to spread good practice. So that's the other thing that I would want to emphasize from that meeting. It's really, really important that we make the joins, that we start looking at not just what's happening, but get underneath some of the detailed information and look at that important relationship. Thank you.
Thank you very much, Ian. And I can't see anyone indicating that they want to come in at this stage. So just before we move on to the next report, I'll just invite Helen, our Director of Corporate Governance and Board Secretary. I wonder, Helen, whether you wanted to make an observation about the champion role and what, if anything, we need to do now, or as Kirsty intimated, whether we wait until the outcome of the various reviews has reported.
Thank you, Carl. Helen Bushell, Director of Corporate Governance and Board Secretary. Morning, everybody. I think probably, Carl, there's the answer is both. I think that technically speaking, according to the Welsh Health Circular, the board champions roles does exist within the Health Board. So I think there's something important to make sure that we're clear what that means for us and what the Welsh Government guidance says. So I think we've put that action onto the board log so we don't lose that. And I think there's some work we can perhaps do through our chairs forum to develop that a little bit further. But Kirsty's absolutely right. There is a wider governance review being undertaken on behalf of the Minister. I was also in contact with a colleague last week in Welsh Government who told me that the recommended list of board champions is also being reviewed currently. So I think the honest answer is both. There's a short-term answer for clarity within the Health Board. I think we will then need to respond to whatever the governance review tells us a little bit later into next year. Thank you.
Okay. Thank you, Helen. So this will be picked up within our committee chairs forum, and that will be reported back to our next meeting. So thank you, Kirsty. Thank you, Ian. A really good development, I think. And so we move on to the Executive Committee report. Hayley, any additional comments, please?
Yeah, thank you, Chair. So you can see it's a very comprehensive update of the last 5 meetings that we've held. So I'm not going to attempt to summarise it in any way, shape or form, but there was one point of accuracy on page 8 under the integrated quality report, which is the second bullet point down. It references colonial framework. It was actually an error. Sorry, didn't pick this up. It's actually referencing the national nosocomial framework. So just wanted that as a point of accuracy to be addressed. I had a couple of areas I wanted to highlight, if that's okay. So on page 10 of the report, you'll see in a meeting we considered the current arrangements that we have in place for body stores across our hospital sites. And I'm really grateful to Claire Madsen and Jason Crowell for their work in bringing this forward for review in the Executive Committee. So you'll see that we discussed the current arrangements have taken some decisions to make sure that we have clarified the operating standards around the body store facilities, and the board can expect, as we are in the Executive Committee, that the evaluation work to bring this forward to a future committee, that you can see and be assured that these changes have been operationalised, and that there aren't any issues really, that there is a learning that we can take regarding that particular decision. So I wanted to highlight that to the board. Second aspect for me, and this is tied to making sure that we're working as well as we can in as efficient a way as possible, is on page 10 we reference the changes that we've made to the subgroups reporting to the Executive Committee. This was based on work that Helen and others have led with us to make sure that we've got the right issues coming to the right place, and that we're getting that right focus, particularly in light of some of the escalated matters that we're needing to deal with. And then the third point I wanted to pick out was, again, on page 10, just for the board to be aware that in terms of continuing healthcare costs, we know this is an area that's escalated, and in particular we're dealing with in terms of our financial plan and making sure that we're making progress on that. But there is a particular issue at the moment around care home costs. So for this year, we have sort of already agreed a 9.2% uplift for providers. However, we are having further requests for support from the care home sector. So I wanted the board to be aware of that there will need, and there is ongoing discussion with Powys County Council, but also the need for us to connect with the national work stream on continuing healthcare on this as well, which Pete and I are very involved with. So just wanted people to be aware there are particular pressures from providers coming through around uplift requests at the moment for the care home sector. Other than that, I'll take the rest of the report. Happy to take any questions or queries members may have.
Thank you, Hayley. Really, as you say, comprehensive and helpful report. I can't at the moment see anyone indicating that they would like to comment or ask a question. And so if not, then we thank Hayley for, as a very, very useful report, and we move on to the Charitable Funds report. This is a committee that I chair. I don't have any additional comments, but as with other reports, very happy to receive questions or to discuss any aspect of the report. No one's indicating that they would like to discuss anything from that report, so thank you. And we move on to our Delivery and Performance Committee report. This committee is chaired by Ronnie Alexander. Ronnie, do you have any additional comments to the report?
No, thank you, Chair. The report has been circulated and I'm taking it as read, but happy to take any questions. Thank you.
Thank you. Would anyone like to ask a question or raise any issue in relation to the D&P report? No, so thank you for that, and therefore we move to another important committee, the Planning, Partnership and Public Health Committee. This committee met very, very recently, and therefore There isn't a written report, but Robert, who chairs this committee, is going to give a brief update from the recent meeting. Thank you, Robert.
Thank you, Chair. Yes, Robert Lewis, independent member. I'd like to highlight just 3 items from the recent meeting. The first is the strategic change to services. The report on proposals to change service, the strategic change report, is regularly received by the committee and its scope is quite comprehensive. Neighbouring health boards usually inform us of proposed changes at the beginning of the cycle, and the consultations of today usually become the concrete plans of tomorrow. There are lots of service changes bubbling to the surface that will result in some improved facilities as well as different and sometimes more distant locations for services. And just to give a flavour, an example, there may be changes to where stroke patients will be taken in the future, with Worcester and Cardiff becoming centres of choice depending on where you live. The strategic change report is regularly updated and is worth reading. The second point relates to additional learning needs. We're working with Powys County Council, and an update report will follow in between our meetings and be presented to board in January. And the third point is what we call future deep dives. By deep dive, we mean an in-depth study. And what the committee wanted to do was to illustrate the future demands on service, including primary care, resulting from an ageing population. Aware that this will be a big undertaking for our excellent public health team, we've selected just one medical condition as a pilot study, that is diabetes. And so the question we will want answered is, how will the increase in the prevalence of diabetes alter the demands on our service over the next, say, 5 to 10 years? We expect that the scale and demands made by patients with this condition will be mirrored by several other conditions. This work is an example, I think, of the Health Board being proactive, not just being responsive in planning its services, and the work will start in the new year. Thank you, Chair.
Thank you. Are there any questions or comments to Robert in relation to that oral report? Hayley, please.
Yeah, thank you, Robert. Just wanted to again give assurance to the board that with regard to the issue around the Additional Learning Needs Act, that was an active conversation that we had in the joint executive team meeting with Powys County Council at our last meeting a couple of weeks ago, and we will be doing some consolidated work together to make sure that that report that comes through to the committee deals with the issues that were discussed and have just been referenced by Robert. Thank you.
Thank you. Kirsty.
Thank you very much, Chair. Hayley, I'm very pleased to hear that that conversation has taken place with Powys County Council with regards to the implementation of the Additional Learning Needs Act. That legislation puts very, carefully thought through requirements on both organisations, but both organisations need to work closely together to be able to provide a seamless service for children and families. So I'm very pleased to hear that we're working in partnership to ensure that we deliver that. But clearly there are specific responsibilities that are laid upon the Health Board, and I think the most worrying, the most concerning part of the discussion at the recent committee meeting was we're at this stage, we're not able to quantify whether we're meeting our statutory requirements. But I note in that committee discussion that is to be rectified, in March of this year. And I think, Chair, it might be worthwhile, obviously the committee is going to keep a close eye on it, but perhaps the board would want to assure itself that by that time we're in a position to have the data that allows us to make to know whether we're meeting our statutory requirements. At the heart of this are potentially very vulnerable children, their families, but also there is a reputational risk to us as an organisation if we're not meeting our statutory requirements. Thank you.
Thank you, Kirsty. Hayley, would you like to respond to that? And also particularly Kirsty's suggestion as to, the board's sightedness on that compliance issue. Thank you.
Yeah, thank you. Yes, so firstly, that report was received to address some of those data and being able to track where we are against our statutory requirements by the end of March. Part of the reason that's shifted into the joint executive team space between the local authority and ourselves is to try and expedite that, so we get that picture quicker than by the end of March. And we're just scoping through that at the moment, and Claire Madsen is leading that work for us. So completely understand the concern, and that's why it's been escalated to the joint executive team space, because we do need to get that picture very, very quickly understood so that we can understand what additional actions that we need to take. So my suggestion is that depending on the timescale, either it comes immediately back to the committee as a standard item for feedback, or indeed to the board at our March meeting, so that we can give assurance that the issues have been addressed.
Thank you, Hayley. So certainly we'll log that as an action from this discussion. Kirsty, are you content? Okay, thank you. So we move on then to our final committee report, which is the report from our Audit, Risk and Assurance Committee, also chaired by Robert. Any additional comments, Robert?
No, thank you. I think the minutes are very clear.
Any comments, questions, observations in relation to this report from anyone? No, well, thank you very much. As I said earlier, a huge amount of work is undertaken continuously by our various committees, led by their chairs, and so that's noticed and appreciated. We as a board now are asked to receive the assurance that's come to us through these various reports, and satisfy ourselves that assurance is reliable and robust. So I'll assume that everyone is content to support that recommendation. Please indicate if you think otherwise, or if you don't support it. So that's supported unanimously. We move on to arguably one of the most important items on our agenda today, a report regarding the revised 23-24 financial plan and forecast. And just before we get into the detail of this, I would like to offer public assurance that we as a unitary board have spent together quite a considerable amount of time on these matters, and so the report today is a product, if you like, of the detailed and significant discussion and consideration that we have given to these issues over the last weeks and months. But with that brief assurance, over to you, Hayley. Thank you.
Thank you, Carl. And at the moment, I understand, Liz, you'll be driving the slides for me. I'm just not able to see them at the moment, so hopefully we're on the slide presentation contents. Has that come through for other people able to see the slides at the moment, hopefully? Yeah, okay, great. Okay, so absolutely. I mean, this presentation is updating the board on our revised financial plan for this year. I'm sure we're all aware of the national financial context in which we are all working in terms of public sector finances, and the particular implications of this for Powys will be set out in the presentation and in the discussion that we have. We are not alone, so every health board across Wales have this shared challenge. Every health board in Wales had to forecast a deficit in this financial year, and we are alongside every other health board in Wales having this discussion in public board in November to develop our revised financial plan for consideration and approval, based on responding to fairly recent conversations and discussions that we've had with Welsh Government. So just to bit of the history of this, in November, on the 8th of November, we were informed by Welsh Government regarding our revised health board allegations, and we were all given a target control total to work within by the end of this financial year. This was on the basis of very difficult conversations that Welsh Government had to manage cross-departmentally to find additional funding to support the National Health Service across Wales to the tune of over 460 million, and that allocation has been taken into account in terms of the significant cost pressures being incurred across the NHS, but also in making sure that funding I've just mentioned has been taken into account around the target control that we've been offered. So we've had a proportionate allocation of that 460 million, and there is both a non-recurrent and a recurrent element to this, and you will share in the slide a little bit more detail later, but it's really important that within this context, this meant that the plan that we approved early this year has to be revised in order to improve our financial performance, which is equivalent to about 10% of our planned financial deficit before year end. So we'll take you through this step by step, and Pete will also support us through some of these slides, because what we're seeking is for the board to now approve today, based on this discussion, our revised financial plan on the premise that we will be working towards delivery and achievement of the target control total of 12 million, and we'll be sharing with you some of the risks associated with that. On the next slide, the journey to date. So this is work that's been sort of undertaken, as you rightly said, Carl, as a unitary board, and we've been since really the summer, late summer, in discussions about understanding the implications financially for us as a system and what that means around pressures across the whole of the NHS. So you'll see from this slide some of the steps and explanation of all the touch points that we've had as a board to discuss this issue as it comes through to public board today. The issue around the next slide, sorry, I've just, my screen's gone blank. I don't know what on earth's going on. So to deliver this sort of approach around this, we rapidly established sort of an improvement process to develop our scenarios, and we also had a process of designing, reviewing and including discussion with yourselves together as a board in both in-committee sessions to respond to the financial challenge. On the next slide, we've shared with you some of the really important principles we developed as a board to guide our consideration of the options. And in setting out a clear process for review, we basically helped us to really have that clear framework for decision making. Now, the first thing to say is that we wanted to make sure that any decisions that we take, we were minimising and mitigating impact as best we can on patients, and in particular at the heart of our decision making, also trying to make sure that staff welfare is a key consideration, and that we also wanted to make sure that we're not taking short-term decisions that makes things harder for us in the longer term, and that we could see an alignment really with our longer term strategic direction and what we're trying to achieve for the long term. And underpinning all of this, you know, duty of quality and candour is around our focus on clinical patient safety, patient experience and outcomes. So I think that what this framework was about was making sure that we had a value-based approach to financial improvement, and that we were balancing really the requirement to live within our financial means with our duties for improving health and providing and commissioning health services. The next slide talks a little bit about the impact and how we are approaching the next couple of slides, the impact of any decisions that we take. And again, we took this very seriously about making sure that we're able to understand not least the patient impact, staff impact on morale, well-being and recruitment and retention, but also a key issue is how and to what extent any decisions we take as an organisation has a broader impact on the system, including our partners and stakeholders. And again, we've had some active conversations with Powys County Council and others in the Regional Partnership Board about making sure that we understand how all this fits together. For me, maintaining public confidence is really important. So we do need to make sure that we're able to give the confidence that we're being as efficient as possible in our corporate and administrative processes. And in particular, I think wanted to draw attention to the board that we have currently a risk appetite statement that forms part of our approach, but we're currently undertaking, based on the discussion today of our revised financial plan, taking further work forward on our appetite and in particular on the corporate risk registers to reflect the revised financial plan we're needing to deliver on before year end. The next slide sets out the level 2 assessment process that we put in place, and we've designed an integrated approach to quality and equality impact assessment. And this was about helping us to determine and understand what was the risk and impact of potential options, and also helping us to provide a framework for shortlisting to the most the best possible options that would have the minimum adverse impact. Just to share with you, a lot of the options that have been generated have come forward at pace from a wide range of sources, including issues and themes from patient feedback, an open call to all staff, and also detailed review across the organisation. And in particular, the impact assessment work, we piloted it and took a very much a learning approach to make sure that it was fit for purpose. And as an organisation, we will continue to work alongside our system partners, as well as, for example, LLAIS, the National Citizens Voice Body, and others, to look at further any impact assessment work that we need to do as we proceed with implementing the financial plan. So I'll hand over to Pete now, if that's okay, and he'll take us through a little bit more of the detail of the basis on which we've received the control total. Thank you.
Yeah, thank you, Hayley. Good morning, everyone. Pete Hopgood, Director of Finance and IT Services and Interim Deputy Chief Exec and Director of Primary Care. So really just to give some context to what Hayley's already taken us through. As of month 6, the Health Board was £500,000 off its financial plan, and that was a £500,000 adverse position in relation to our original deficit plan of £33.5 million. Within that position, we'd identified £7.5 million worth of savings and mitigating actions, and we're actually overachieving against this target as at month 6. And we had a range of balanced view of opportunities and risks that we were managing to deliver our original deficit plan. Now, as at month 7, and we'll be getting into month 7 later on in our board agenda, our share of the funding that Hayley has already alluded to is 18.3 million. And this 18.3 million is made up of 14.2 million, which is recurrent, but that is recurrent based on a number of conditions, and 4.1 million, which is non-recurrent. This gives us a revised financial forecast plan of 15.2 million. And that is very simply the 33.5 million less the 18.3 million allocated to give us a 15.2 million plan and position. As of month 7, the Health Board is £300,000 off against this plan, but forecasting to deliver that 15.2 million. However, as part of the funding and part of the pressures that Hayley's described, we've been set a target by Welsh Government to improve our plan by 3.2 million and to deliver a final position of 12 million. And that is our target control total. So just to be clear, we're required to meet that 12 million control target. So that means that we've got to ask for a further improvement against our original savings plan, the 7.5 million that I've already referenced. and a number of the actions we've taken have already been covered in some of the things that Hayley's mentioned. But if we could move on, please, Liz. So just again, just a reminder, as Hayley said, so some of the actions we took in response to this challenge was that we immediately mobilised our deputy director, our assistant director cohort of people, and we put together a programme with appropriate governance to generate ideas and how we can improve the financial position. This was a comprehensive list of ideas with nothing off the table. The evaluation process has already been described, and we've already mentioned, and it's really important to emphasise that this has been a whole board process with everyone involved, with a number of workshops and really strong engagement. And as part of that work, we were able to submit our schemes to meet the planning scenarios. That was to improve our deficit by 10, 20 and 30%. And as Hayley has said, we had the quality impact and equality impact assessments as described. And on the back of this work, we were able to implement a number of schemes to get a bit of a head start to improving our financial position. Move on, please, Liz. So where are we at the moment? So as a reminder, with the funding allocated, it's taken our plan to 15.2, and we have a requirement to improve that plan by 3.2 to hit our 12 million control total. So actions are underway and to achieve 1.6 million of that additional 3.2 million ask. We have 15 schemes which are targeted to deliver a forecast 500,000, and there's a number of areas where reduced expenditure and slippage against funding will give us a 1.1 million benefit, and that's all in line with the conditions and correspondence as received by Welsh Government. There are some schemes that potentially will not be looked at this year, but could be something that comes into thinking in future years. And just for absolute completeness, there were a number of options which were identified which would have required a national decision. They were beyond our own decision making process, and they've not at this stage been taken forward. Thank you, Liz. I think I'm handing back to Hayley now.
Yeah, thanks, Pete. So, I mean, the next 3 slides is a little bit the detail of some of the schemes that we're proceeding with. And, before we, talk about this is really difficult work for us as a health board. There are substantial impacts that we have to manage across this, but the majority of financial improvement you'll see from the examples from this slide and the next are delivered through measures that improve back office efficiencies. And also it's about utilising slippage without direct impact on patient-facing services. For example, you'll see on this slide some of the work that we'd already changed around agile working means that we'll be much more planned in terms of not utilising and using energy for parts of buildings that aren't fully utilised, etc. So quite a lot of work to make sure also that we have in place all of those mechanisms to make sure corporately and administratively that we're dealing with some of this financial improvement actions that is required. A small number of the schemes, the second slide that sets out the progress of schemes, talks about delaying or shortly delaying planned investments to reduce the 2023-24 impact this year. So I just wanted to, because I'm sure this would be a question I would ask of us, is that some of this is about making a judgment call about whether we were going to be able to deliver some of this capacity due to workforce constraints. So, for example, some of the dental investments, it's, unfortunately, we have got some issues around workforce and capacity to deliver on some of those aspects already. And also, just you'll see from some of these examples, the work that we're doing on individual patient funding request work is both national and about local application, and also the broader work around specialised services, working within the committee to make sure that we're progressing any opportunities through those routes as well. So just wanted to give you a bit of a sense on some of those issues that we're taking forward at the moment and continuing to discuss. But Pete's already mentioned about schemes that we've discounted for 23-24, and that was based again around the impact assessment work that we undertook. So some of those examples which shows that nothing was off the table was things like reduction in opening times of certain services, including MIUs and radiography, as well as we risk assessed the position around planned care treatment as well, and some of these have been discounted for this through this process. But I wanted the board to see and the public to see that everything has been considered as part of this process. So I'll hand back over to Pete now, who'll take us through some of the further opportunities and risks that we've got to manage.
Thank you, Hayley. So as I've already mentioned, against our financial plan, we have the usual range of risks and opportunities that we need to manage, that being to try and mitigate the risks and crystallise the opportunities. And some of those include our performance of our provider organisations in Wales and England, the obvious pressures that we're gonna see during winter, numbers of continuing healthcare packages and staffing issues, as we've already described. Also worth pointing out that there's some national work going on which is linked to the Value and Sustainability Board. There are a number of workstream areas where, as Hayley's already mentioned, we're closely linked into, and we're looking to maximise any opportunities from that national work. And that includes areas including continuing healthcare, agency spend, medicines and prescribing, and in relation to non-pay and procurement. So we move on to so as a reminder, as we said, our plan has moved from 33.5 to the 15.2. If we can stay on the first slide, please, the previous slide, please, Liz, and the need to improve by a further 3.2 million. And recommended options for us to close that gap of 1.6 million, as I described earlier. We've identified 1.6 million against the additional 3.2 million ask. Include, we've got some potential non-recurrent benefits in relation to a VAT rebate, which could be 0.4 million. That's relatively low risk. We are forecasting an element of dental contract underperformance, again relatively low risk and 0.4 million. We have got a target stroke opportunity to improve our financial position in relation to our commission services. That's across a range of actions, with a potential of 0.4 million there, which is medium to high risk. We've got a challenge to reduce our agency expenditure, particularly in relation to agency nursing in linked to mental health, with a potential to improve by 0.4 million, and some opportunity to improve our continuing healthcare linked to the national programme of 0.1 million. And also the opportunity for further slippage in relation to our Welsh Government funding streams of 0.2 million. So there's a range there, and as you can see, that comes to a figure higher than the 1.6 million. But if we now do move on to the next slide, this is where we try to put the whole financial plan, movement and revised plan and forecast into one slide. So hopefully this all flows nicely. So if I just talk us through it, we have our original financial plan of 33.5 million. A reminder again, included in that plan was the £7.5 million worth of savings and mitigating actions, which we are on track to deliver. We've received £18.3 million worth of additional funding, with a mix of recurrent and non-recurrent as described, to give us that 15.2 million interim position at month 7. Our actions underway to deliver against the additional 3.2 million ask, including slippage against funding streams, our 10% schemes of 0.5 million, the VAT rebate I just mentioned of 0.4 million, and the dental underperformance of 0.4 million, give us a 2.4 million improvement that takes us to 12.8 million, 0.8 million away from that 12 million control total. And then for the further stretch, the further improvement required, we've got those areas again as described: the commission services, the agency expenditure, the continuing healthcare, and potential further slippage. As you can see, that those further stretch comes to a figure of 1.1 million if all were realised, but we're setting ourselves that challenge to deliver that 0.8 million to take us to that 12 million control total. So it's really important for me to say that this is a plan stroke forecast that will take us to that control total, but it will be challenging. All of the areas identified require action. We need to complete the action that we've identified. We have done some great work as a board to identify areas we can influence and action we can take, and a lot of progress, and it's put us in this position, which is a relatively good position to deliver against against the control total. But just because the numbers are on a page, it will take a lot of action, and the focus will all be on delivery, assuming that we support and accept the revised financial plan. I think now I'll hand back to Hayley. Thank you.
Thanks, Pete, and thanks for summarising that so clearly in that last slide. I hope that this presentation so far can give the board and the public some confidence regarding the process that's taken us to the revised financial plan that we're presenting today, and in particular how we've brought those board principles and the level 2 assessment process as part of the picture of what we should be pursuing in year. I think there are some additional points in our delivery approach that I just wanted to highlight to the board, and again, there are later items on the agenda around this, which is firstly the annual plan and our progress around this. It is going to be tough, there is no doubt about it, that this scale of financial improvement is at a scale that the Health Board hasn't been ever asked to achieve before. So therefore the level of attention and time and capacity that we need to redirect to support getting some of these actions in place is substantial. So later we'll be discussing our progress against our current annual plan, and also the particular issues that we've taken to make sure that we've got the right skills and capacity available to take this work forward. I think it's really important that I mention about the impact of this is at the moment today at an organisational level, but clearly every health board is doing this process, and their neighbouring plans by health boards and trusts are currently being considered by boards this week as well. So we have started, and I want to give assurance to the board, we've started the discussions with our neighbouring health boards and trusts to understand the position, and once decisions are taken this week, we'll be needing to understand that impact for the whole population, recognising the pathways for our patients and how care is currently both delivered within Powys and commissioned across the border. So that assessment of neighbouring plans is really important, and also the wider buy-in. So I know I talk a lot about external public opinion, but our staff, bringing people with us on this journey is really important internally, as well as with broader partners and stakeholders. And I think that in particular, we know the financial outlook for next year is going to be extremely tough as well. So our planning for 2024 onwards is needing to be in the context of a continued very pressing financial challenge for us all to deliver in the public services. So we'll need to make sure that we have clear public engagement and potential consultation on the scale of changes that we will need to take forward through the future accelerated sustainable model, but also generally with how that fits with the work that's being undertaken with other partners, and obviously notably for us in Powys, it's the Sustainable Powys plan that the local authority are leading. So just finally, really, just a couple of points from me, if that's okay to conclude. So I think that, our continued focus to improve our delivery confidence is there. The context of this work is going into winter with operational pressures and the need to be agile in how we prioritise and deliver our day-to-day focus on what we're here to do, and that's to serve the Powys population. So the context we're working in is a challenge currently as well. But I just wanted to thank really both the maturity and the support of the whole board, but generally the staff and other partners in helping us to come to a place where we're able to propose this revised financial plan today. I think it is really important that we do our best to get this so that we can secure the recurrent funding on an ongoing basis, because that will really support us towards a more sustainable future. And then later we'll have papers to talk about our 2024 onwards planning cycle as well. So I hope that's a helpful summary, Chair. I appreciate we took quite a bit of time on that, but I thought it was really important that we went through the details so we all had that shared understanding. Thanks.
Thank you, Hayley. Thank you, Pete. As I said earlier, arguably the most important and substantial item on our agenda today, and which is why I think it warrants the time and attention. So we do have a couple of people that have indicated they want to come in. So I'll go firstly to Robert. Thank you.
Thank you, Chair, and thank you for that presentation. A lot of work being done behind the scenes, and I look forward, Hayley, to seeing the plans about the public engagement, not just 23-24, but as you say, in the years ahead. I have a specific question. There is a statement in the slides. It says, for completeness, there were options which were identified for national decision-making consideration. I think a lot of people reading that would find that quite mysterious. So can you provide me with some examples of those options, and whether or not we know that Welsh Government is actively considering those in the years ahead? Thank you.
Yeah, thank you, Robert. Really important question. So as part of our submission to Welsh Government, we identified a number of areas that they may wish to consider to give a national policy direction across NHS Wales. My understanding is, so you know, that they are doing active work at the moment, Robert, on those areas. They're considering both the strengths and weaknesses of those options. At this stage, we haven't had any further feedback other than to be told that for the 23-24 in-year planning, we can't assume any changes to national policy direction to support the delivery of financial improvement. But as soon as that assessment and that information is shared with us, Robert, we'll share that with the whole board. But I do know for a fact that the Welsh Government team are looking at a number of options at the moment that have been suggested by NHS bodies for consideration and for assessment.
Thank you, Chair.
And Nina, lovely to see you, Nina. Thank you for being with us. Nina is the Director of Social Care within the local authority and an associate member of our board. So Nina, over to you.
Good morning all, thank you, and thank you for the presentation setting out the financial kind of situation and challenges that you're currently facing. It's very interesting, and thank you for sharing that. Just two questions, if I may. I noted that there was a target of 0.4 million from commissioned services, and I was just wanted to ask what work had been done on understanding the potential impact of those reductions on commissioned providers. And then the second question was around continuing healthcare and whether it's appropriate to be setting a target and a saving to be meeting from that area, and what work has been undertaken to understand the impact of that on potential partners and patients. Thank you.
Yeah, thank you, Nina. Shall I come in, or do you want me to? Firstly, just in terms of commission providers, that it's a really important aspect for us. For example, one of the issues for us is around the money that was allocated to support long waiting patients across Wales, and the allocation was given directly to providers to deal with that. So there's an element around technically around this, Nina, making sure we're not double counting or double paying for a certain level of activity. But again, very happy to share with you. But a lot of this is about our main commissioned providers in the acute sort of pathways with regard to that particular funding stream. But you'll see in the earlier point, which is the treatment of third sector inflation, was one of the ones that we'd already indicated. So, you know, there are difficult issues in this, but, you know, clearly that was on a separate line, but the 400k is specifically around acute service providers. In terms of continuing healthcare, there's an expectation that the Value and Sustainability Board, National Board, has been established to oversee those key areas of cost pressures and to suggest ways of working to improve the situation. So it is not unreasonable to set an expectation about a level of financial improvement around continuing healthcare, but just to reassure you, this is not about stopping people getting care. This is about how we negotiate with our providers, and in particular, at the moment, we are looking at a national team on the high cost and high use providers, and doing some further assessment work in that space. So some reassurance, this is not about cost shunting, and this is about getting the best value from the contracts that we already have. And the view is, from the initial work that's been undertaken, that there are some further opportunities for us to take there.
Nina, okay.
Yeah, no, thank you. I appreciate that. Thank you, Hayley.
Thank you. So we have another couple of colleagues that want to come in, namely Katie and Kate, and then we probably need to conclude this item, take a short break, and then reconvene to continue with the agenda. So Katie, so good to see you, Katie. Katie is the Regional Director for Llais in Powys, the Citizens' Voice body. Thank you, Katie.
Diolch, Chair. Just to reiterate, you know, the amount of work that has gone into this is quite incredible, and I just want to say thank you to the team, Hayley, you and your team, for keeping us in the loop along this what's been quite a challenging process at a high level. And we're very grateful for that, working on the basis of trying to minimise surprises. I just wanted to comment, I suppose, that the prioritisation in this process on safety, patient experience, back house, and at all costs trying to avoid the impact on patients has not gone unrecognised by us in Llais in Powys, recognising that there probably are longer term sustainability challenges, but just sharing our commitment to work with you going through that process for 24, 25 and onwards. So yeah, I'm extremely grateful that the plan has managed to make the majority of savings from non-patient focused services. I think just also, Chair, to provide you and colleagues with reassurance, the issue of neighbouring health boards' plans has been picked up at a national level with Llais. I've picked it up at a national level. So I'm hoping, as a national organisation, we have certainly asked for an oversight of what those plans are, which will provide Llais at a national level to understand the impact on other health boards. Obviously, in my instance, it's my focus will be on understanding the impacts on Powys. So we'll obviously feed anything we pick back up in, and I know that Hayley and Pete and Stephen will feed anything that they pick up back to me. Thank you, Chair.
Thank you, Katie. Hayley, any response to Katie before we move to Kate?
Yeah, just two things really. Firstly is how we get that complete picture, that national picture of changes. I know that there's some work that the planning directors across Wales are pulling together that immediately after the boards have taken decisions around their revised financial plans, and absolutely we need that complete picture nationally, both so really support that. And secondly, just to your point around and I think Robert mentioned it earlier as well. So the the engagement and consultation approach about how we do this both internally with partners and with the general public is really important. So Katie, I know we've got a really mature relationship, so how we work alongside Llais to design that in a way that is appropriate will be important. So I'm in the space where we'll all have to co-design that together, and the conversation I had with the local authority, I hope Nina doesn't mind this, but saying this, you know, you may want to comment, is that we also need to do that not just at an organisational level, but do that at a system level, so people understand what that does that look like from a place-based perspective. So we're on a bit of a journey on this, but you know, again, helping prepare the public and our staff about the scale of change and challenge that we've got to manage is really important. But how we do the work is equally important. We've got to do it the right way and take the right level of time to do this properly, which is why taking short-term decisions for this plan by year end would have derailed the need to work properly on a longer term model for Powys under the accelerated sustainable model, and I know we'll work alongside you to make sure that that does pass the test of reasonableness and appropriateness in terms of your expectations as the National Citizens Voice body as well. So thanks, Katie.
Thank you. So final contribution from Kate before we take a short break. Thank you, Kate.
Yeah, thank you, everybody. I just so just without being repetitive, just to really assure everybody how seriously we've taken this, how really challenging it's been. But what we've seen is the teams really come together and as responsibly as we possibly could, really consider so safety, quality, and the long-term strategy have been considered throughout. I think the sustainability issue is really important to emphasise because it's not just about the finance. The sustainability in itself is a financial challenge. The staffing issues are across the NHS and they in themselves bring safety and quality challenges. So we've considered that throughout as you know, value underpins everything we do. When I say value, that's about use of resources and about making sure we get the best outcomes for our patients, and that work has underpinned this as well. So we've got a lot more to do, but really just to highlight that the safety and quality, sustainability and value have been really at the heart of this and will continue to be at the heart of it. It's very challenging, but what I have, you know, I really am as comfortable as we can do that we have considered that throughout and really tried hard to minimise the impact on our patient staff and frontline services.
Thank you very much, Kate, and I just want to support that comment. Indeed, others, you know, certainly as a unitary board, we have consistently recognised the importance of planning for the future and planning for the future in a sustainable way, and not, I suppose, bowing to the temptation of being very short-term in our thinking, and that's certainly planning for the future. The principle of co-producing that plan with people, with partners, and with all stakeholders is at the heart of what we're committed to, and is certainly at the heart of how we intend to operate. So thank you all very much. Important, difficult, and but nonetheless very, very crucial. So on that note, we're going to take a break. Can I suggest that we take well, just short of 10 minutes for a break, reconvene at 11:30, and then we'll go on to other items on the agenda. Thank you. Croeso nôl i'r cyfarfod yma, and as I welcome everyone back after the break, before we go to the next item on the agenda, if I could just go back to the previous item, the revised 23-24 financial plan and forecast, I omitted to put to the board the formal recommendation, which is that we note the financial improvement required of health boards in the context of the current financial performance, and also that we approve the revised financial plan for 23-24 that has been shared with us today. If anyone does not support that recommendation, would you please indicate? Thank you. That is then supported unanimously. So we go on now to item 2.2 of the agenda, the annual delivery plan Q2 report, and to Steve, our Director of Planning, Performance and Commissioning. Thank you, Steve.
Good morning, all. As the Chair said, I'm Stephen Powell, the Director of Planning, Performance and Commission for Parish Teaching and Health Board. So this report is our progression against our current submitted plan for the year 23-24, and we've also taken the opportunity to consider resetting some of our planned activities for the remainder of the year. So the cover paper deals with the following things. So it captures our performance against our submitted plan to the end of Q2 against the variety of strategic aims and milestones that we did submit, but also critically and in line with some of the conversation that we've heard earlier, in order to address some of the financial challenges, we've taken the opportunity to consider a partial reset of our plan towards the end of the year. So the report itself continues the same production process as with previous quarterly updates, in that each director updates their progression against their plan for the given quarter. The output then is collectively moderated and reviewed and challenged at various executive touch points. And then this report, if approved, will go on to Welsh Government as a official progression statement of our plan for the current financial year. The report covers the process by which we've reviewed our forecast actions for the remainder of the year. As we've heard in the earlier presentation, all NHS organisations were asked to improve their financial position, and as a result, we've worked through a two-stage process to both review our capacity prospectively for the remainder of the year, to see what capacity can be released where appropriate to target financial improvement. But we've also recognised the need to maintain capacity and focus to deliver the ministerial priorities, because that's still a very key component for the NHS in the current financial year and the Health Board, as well as the financial position. And we wanted to clearly capture the areas that will be deprioritised, rescoped or rescheduled in a transparent way through the planning process. It's worth noting that this report and the planning process within the Health Board is also part of the enhanced monitoring Welsh Government oversight process, because within that status of enhanced monitoring is for both financial and performance reasons that we've got that status. So our future quarterly reports will be against our revised reset plan if the plan is approved today at this meeting. The detailed report in the PowerPoint presentation describes a summary overview of performance to the end of the second quarter, particularly on page 3 with the pie chart progression, and some of the non-delivery of the milestones is due to either slippage in key clinical posts or some slippage in some of the digital projects. By and large, the Health Board is progressing well at the end of Q2, but the report itself is then quite detailed, and some of the narrative that's highlighted in pink depicts the milestones that have been requested to be reset by individual directors, and at the foot of each section of the report goes on to describe why each of our respective directors has recommended some of the milestones to be reset for the remainder of the financial year. So just in terms, Chair, of overall closing comments, the overall strategic aim of our plan remains intact in terms of direction of travel on a 10-year plan for Paris, but we've had to make some short-term adjustments to improve the delivery of control total and performance against ministerial measures. And as an executive team, we felt it would be better to take that sort of proactive stance to reset some of our planned activities to be sort of upfront in that regard.
Thank you very much, Steve, and thank you for being very concise and clear in that presentation. Much appreciated. So, are there any questions for Steve, or any contributions to conversation in relation to this agenda item? Now, I'm not seeing anyone that wants to contribute at this stage, so we go to the recommendations, and just picking up on Steve's final point in terms of the plan reset, we have spelt out for us in the report very clearly the change requests and so on at the bottom of each section. So in terms of approving the reset, that's all there for our consideration. And so yeah, Chris, you'd like to come in before I put the recommendation.
Yes, Chair, if I may. Thanks, Steve, for the presentation. I think it was really helpful. I just want to go back to the pie diagrams that you mentioned, because there's one on digital, which is it's got some red in it, and it's a large chunk on it. Can you just elaborate a little bit further? Is that slippage there? Is that a result of people not having people in post, lack of skills, lack of resource, or lack of infrastructure? Because in some ways going forward, that's going to be a key element to being able to deliver some of the new presentation of services going forward.
Thanks, Chris. I don't know whether Pete, would you like to comment on that aspect?
There's a mix in there actually, Chris. So there's partly will be a link to when funding is available, but in the main, some of those linked to national programs where they're led by DHCW, and there's elements of national actions being needed before we can progress as well. So your point is well made about the future, and obviously that's a focus of everything that we do, about making sure we got the right capacity, resources, skills, expertise to deliver the ambition of the Health Board across all of its services.
Okay.
Thank you.
Thank you, Chair.
So we're asked to assure ourselves that we have received assurance, as it were, that the organisation has appropriate mechanisms in place to monitor delivery against the annual plan. We're also to satisfy ourselves that we are assured in relation to the delivery of the plan to the end of Q2, and as Steve has highlighted, we are asked to approve the reset of the annual delivery plan for the rest of this financial year. Again, if anyone would like to indicate that they don't support the recommendation, would you please do so? That too is supported unanimously, and we move on then to look further ahead in terms of our planning approach for 2024 onwards, and we're back with you, Steve. Thank you.
Yes, thank you, Chair. So this is agenda item 2.3, and the short cover paper describes the fact that we've opted to do a 5-year plan, which is slightly longer than the traditional 3-year plan an NHS organisation in Wales would undertake, but it's in recognition of some of the workforce finance and service sustainability challenges that we face, that we thought a 5-year plan was the better route to go down, and that way forward around a 5-year plan is gaining a sort of wider momentum across Wales. So there's quite a detailed presentation that has been through a board development session and also through a PPPH committee, as Robert referred to earlier. At the moment, the planning guidance for 24-25 onwards has not yet been released, but we clearly know some of the challenges that we're facing and some of the performance outcomes and improvement in the health population and such that we need to be addressing. So we don't need to necessarily wait for the planning guidance to come out in its absolute detail, because we can just get on with it and start planning. So there is a comprehensive slide pack that accompanies the cover presentation, and in that the presentation tries to capture a lot of the influencing factors on our plan. So it covers, for example, our current year progression, because our performance in year and the focus outturn position provides the start point for next year and beyond. The report also considers some of the environmental factors that influence a health board, from the sort of classic pestle analysis, and by that I mean the political, environmental, social, technological and legislative changes and environment changes that impact on our thinking, and is also the expected deliverables that the planning guidance will lay upon the health board and the wider NHS for improvement. Slide 12 of the pack probably shows some of the influencing factors over the next 10 years. So Public Health Wales and Welsh Government have done a comprehensive review and forward look of some of the influencing factors on health provision and population health outcomes in terms of population projections, long-term conditions, risk factors, staff availability, economic considerations and new technology. And so what we're trying to do is build all those factors into our plan. We obviously, as Hayley has said earlier, we need to work alongside our local partners in our system. So we're absolutely aware and working closely with Paris County Council in developing their sustainable Paris and our own Better Together accelerated sustainability model, so that we bring those two key pieces of change program work together to influence our outcomes. And the final couple of slides just document the timescale, because we do need to submit a plan by the end of March. We need to, as well as submitting a narrative plan, we need to submit a comprehensive numerical plan that captures the volume of activity that we're going to deliver within the workforce that we've got available and within the finances that we can afford. So that will, no doubt, that will feature some of the financial challenges as we move forward. And the final slide just captures the 6-stage route map and where we currently are in the process, and a key decision point to allow production to continue will be our next board development session in early December. We will be seeking to finalise some of these planning parameters to build our plan. Thank you.
Thank you very much, Steve. And as you quite rightly say, this has already been the subject of some detailed discussion and scrutiny within a board development session, and also within the Planning, Partnerships and Public Health Committee, and so it has already received that detailed discussion and scrutiny. But does anyone have any question, comment or contribution to make in response to Steve's presentation and in response to this report? No, therefore, thank you very much. So we are asked to consider the approach that Steve has set out for us in regards to the development of our next 5-year plan. And of course, this will be supported, as we've already acknowledged, by our Planning, Partnerships and Population Health Committee. If anyone doesn't agree with that recommendation, please indicate. Then that too is supported unanimously. Thank you. We turn to 2.4, agenda item 2.4, and we turn our attention to the South Powys programme, and more specifically, the consultant-led maternity and neonatal care. And our Director of Nursing and Midwifery, Claire Roche, is going to guide us through this item. Thank you, Claire.
Diolch. Thank you, Chair. So I will take this paper as read. This is item 2.4, and this paper relates to the board being asked to approve the recommendation that the strategic pathway change for consultant-led obstetric and neonatal care for the South population is formally transferred from Aneurin Bevan University Health Board to Cwm Morgannwg University Health Board as a result previously of the South Wales programme. I want to really highlight for the board some assurance around the suitability of that change now being formally enacted. And the first thing to note is that the final IMSOP report, the IMSOP panel, was established within Cwm Morgannwg University Health Board as a result of the report into maternity services there back in 2019. And that panel submitted a report back in actually September 2020 that outlined that the conditions for sustainability are now in place in the Health Board, recommending that the panel be stood down and a requirement for ongoing mentoring and support for the remainder of the neonatal improvement at that time. In September of this year, the de-escalation was enacted from special measures to enhanced monitoring in Cwm Morgannwg University Health Board. There has been significant work done in the Maternity and Neonatal Safety Improvement Board, and as a result, we as a Health Board have revisited our readiness assessment in preparation for these pathways being formally approved for change. So the recommendation is that the board approves the strategic pathway change for consultant-led obstetric and neonatal care for South Powys women and families from Aneurin Bevan to Cwm Morgannwg University Health Board. This will be reflected in the commissioning and contracting arrangements both within AB Health Board and CTM Health Board, but of course recognising that a number of women have already chosen to receive their care from Cwm Morgannwg Maternity Services, and that there has been a significant period of time between the changes in the South Wales programme, the subsequent report into CTM Maternity Services, not least the pandemic and the transfer of the obstetric maternity services from Neville Hall to the Grange University Hospital. But we are now at a point where we feel we can recommend this to board. Thank you, Chair.
Thank you, Claire. Very helpful. Kirsty, would you like to come in, please?
Thank you very much, and thank you very much, Claire, for the paper today and your opening statement. Can I ask, in the accompanying papers, it talks about how we will mitigate against the potential risk that trends or concerns are not spotted at CTM, and of course that was part of the problem initially, was that trends in that service were quite late in coming to light. I'm just wondering how you intend to feed that back into our own PECS committee as part of your integrated quality report, so that we can continue to have sight not only on our own maternity services, which you regularly bring forward reports to, but actually we can look at our commission services and that information will flow into our work. The report also talks about fetal medicine and the need to change our pathways for women who need access to fetal medicine, so that they end up going to UHW rather than going into the Bristol service, which might happen. So I'm just wondering if you could confirm that that pathway is in place, so that Powys women needing fetal medicine in the south of the county will access service in Cardiff. And I'm just wondering, as you said, some women have already voted with their feet and have already switched to that service. But I'm just wondering what communications will we be engaging with patients about this formal decision that we've made today and that formal switch of service, and what assurance we'll be able to give them if they have any residual concerns arising out of the negative publicity and the history of CTM services. How are our midwives going to be able to support women along communications of the change, but also some reassurance? And what plans do we have to capture women's experience if they are accessing that service in the future? Thank you.
Claire, please.
Lovely. Thank you, Kirsty. Really, really important questions there, and I'll address them in turn. So the first question around how will we provide assurance through the PECS committee, through the integrated quality report. We have a monthly maternity matters assurance forum within the organisation that I chair. That happens on a monthly basis, but on a quarterly basis, that meeting is extended to a longer period of time and is an assurance meeting on a quarterly basis. And there is a focus in that meeting initially on our provider services and receiving an assurance report for our own provider services, but we also focus very heavily on all of our commission services, which of course do include Cwmtaf Morgannwg, Shrewsbury and Telford, Hereford and Wye, etc. And we will maintain undertaking that commissioned report, and that will then report back into the Patient Experience and Quality Committee when we provide both our maternity services paper, but indeed using our integrated quality report as that mechanism for assurance. So that is the first question in relation to our assurance reporting. In relation to fetal medicine, yes, I can confirm that those women do have a pathway into fetal medicine at the University Hospital of Wales. In terms of that pathway, obviously through obstetric services within CTM services, so that pathway is extended to women in the South Powys area. In terms of communication with families, we actually have very robust communication with our families through their named midwife, and because of the nature of our maternity services, given that any woman who actually meets the criteria for obstetric-led care during their pregnancy, we would have significant and long conversations with her during both her booking appointment and throughout her pregnancy around her commission service provider in terms of being able to receive feedback from the women, but also to be able to make sure that women understand that pathway. I think it's really important to note that this has happened over a number of years and been impacted by a number of significant events. So actually, in reality, our women have already transferred very naturally into that pathway. So this really is a formal approval of that from a governance perspective, but the reality will be that actually this will not be a sort of a surprise message to our communities in terms of that change of pathway, but I can have quite significant confidence in our midwives to be having those one-to-one conversations with women and families. And then finally, in terms of capturing experience, both the maternity services team and our central quality and safety team have been working really hard to be able to capture those experience of people who use commission services. So we will be focusing on how we put out very bespoke surveys to people who use commission services. There are conversations with women and families when they end their period of time within the maternity services, when they're then at a point to move into the health visiting services, where their feedback and their experience are captured in a one-to-one with their midwifery teams. And of course, we report that through our monthly maternity matters assurance committee, or group rather, I should say. Thank you.
Kirsty, you content? Would you like to comment?
Very much so, thank you.
Thank you. So I can't see that anyone else wants to comment on this particular agenda item. So thank you, Claire, once again. We come to the specific recommendation, which is that we receive the contents of the report and importantly that we approve the recommendation for the strategic pathway change for consultant-led maternity and neonatal services for South Powys to be provided by Cwmtaf Morgannwg University Health Board. Does anyone want to indicate that they don't support that recommendation? In which case it's supported unanimously. Thank you. We turn now to item 2.5 on our agenda and to the Director of Corporate Governance report, and therefore to Helen. Thank you, Helen.
Diolch, Carl. Thank you very much. So pleased to present the report to you today. There are 3 items for your consideration. I'll just give you a very brief overview of the 3 and then happy to take any questions. So the first one relates to an amendment to the model standing financial instructions, specifically in relation to capital and estate-based payments and projects. This originated from an internal audit report and a recommendation from our internal auditors to review this. It's been subsequently picked up through our audit committee because of that recommendation. I've included for you as the appendix the paper which does provide more detail that was then considered by our Innovative Environments Group and then subsequently supported by the Executive Committee. So as you can see in the paper there, it essentially recommends a departure from the model standing financial instructions into something that we believe is more in line with the reality of capital payments. Of course, important for the board to also be assured that we do have an annual capital plan that is approved by the board, and any significant capital projects would also have the outline and full strategic business cases. So there are different levels of control in place for both the board and from an accountable officer perspective. That's the background on that one. The second point in the paper relates to Chair's actions. In accordance with our standing orders, these are matters that are considered with the agreement of the Chair, the Chief and 2 other independent members and myself, and they're generally taken by exception when we don't have a board environment or a formal board committee meeting when we can consider these matters. There have been 2 taken since the last report, one on the 3rd of November in relation to a decision not to apply to be a core participant for the UK Public Inquiry Module 5, and the second one on the 11th of November in relation to a Welsh Government request for board approval for our strategic cash request for the end of the financial year. That was following the technical request from Welsh Government. And then, Carl, lastly, the third item in the paper relates to our board committee membership. You referred earlier in the meeting to the very sad passing of our independent member, Mark Taylor. Mark left a big gap in our committees whereby he was chairing 2 committees, both the Delivery and Performance Committee and the Audit and Risk Assurance Committee. So with the support and agreement of both Ronnie and Robert, and under your guidance, Carl, we've made some changes and recommendations to both to the chairing of those 2 committees. So we've summarised that in the paper, and for completeness, we've included the full membership of the committees as well as the committee chairs. So as per the standing orders, the board asked to ratify your recommendations, Carl, about committee membership. So that's the end of the report. Very happy to take any questions. Thank you.
Thank you, Helen. Please do indicate, colleagues, if you would like to comment or make a contribution in relation to this report and agenda item. Robert, I just wondered whether, as chair of the Audit and Risk Committee, you might just like to offer a comment, particularly in relation to the changes or the recommended changes within the standing financial instructions.
I think they're overdue. Actually, I think they will modernise things a bit. We're often looking at the levels of authority, and you know, some of the levels of authority get sort of left behind as well. So from our point of view of that committee, if I could speak for that committee, I would say we welcome these changes.
Thank you, Robert. Does anyone else want to contribute? No, in which case we are asked to approve the recommended amendments to the Health Board's model standing financial instructions in relation to capital payments. We're asked to ratify the decisions that have been taken by Chair's action over recent weeks, and we're also asked to ratify my recommendations for the changes to committee membership for the remainder of this financial year. Again, would anyone like to indicate that they don't support those recommendations, either in full or in part? Thank you. So those recommendations also are supported unanimously. We move to item 2.6 and to the consideration of the minutes of our previous meeting. Initially, for accuracy, are there any corrections or amendments that anyone would like to suggest? Helen, would you like to comment, please?
Thank you, Carl, and with thanks to Ronnie for flagging this. There is just a point on page 2 of the minutes where we've got a couple of extra words in relation to Ronnie's declaration of interest. We need to remove the words "it was" on the bottom line there of Ronnie's declaration. So with the board's agreement, we'll make that correction for ease of reading. Thank you.
Thank you, Helen. I always rejoice in people who have a kind of eagle eye for those things. Thank you very much. And Katie, please.
Yes, thank you, Chair. Just a very small amendment, but in the Regional Director's report, on page 19, in the second paragraph, it might seem very small, but it refers to the fact that 750 people were interviewed. I think it's important. It's a voluntary, informal discussion as opposed to an interview. And I think from the point of view of keeping in the spirit of what we're trying to do, I would appreciate just a review of the wording of that, please.
Thank you, Katie. Yeah, we'll certainly look at that and reflect, as you say, the spirit of those conversations and in the rewording. Thank you. There are no other amendments or corrections, so we will implement those corrections. So, subject to those corrections, would you indicate if you're not happy to receive those minutes as a correct record? In which case we go to the action log, and Helen, are there any matters that require our attention from the action log today?
Not at all, Carl. Just in summary, there are 3 actions that are open on track that are highlighted in yellow there, and they will continue to be monitored and are due for reporting both today, which we've done in the Gilwen item, and then into January. And then there was 1 item that's been transferred to the Delivery and Performance Committee, so that will now move on to their action log and again be reported back through the Chair's update report. Thank you.
Thank you, Helen. Does anyone want to make a comment or contribute in relation to the action log? No? So thank you for that. Wel, diolch o galon I chi gyd am eich cyfraniadau hyd at hyn. Dyn ni wedi delio efo pob eitem ar yr agenda sydd angen cadarnhad neu benderfyniad, ac dyn ni'n symud rwan at eitemau sydd yma ar gyfer ein sicrwydd. So we move now from items that required our specific approval or decision and to items that are there as sources of assurance for us as board members. And the first of those is item 3.1. And Helen, I think you're going to take us through this as well in relation to the current situation as regards our escalation and intervention status. Thank you.
Thank you very much, Carl. So as the board is fully aware, both in informal session and reported through the Chief Executive's report back in an earlier meeting, the Health Board has been moved into an enhanced level of escalation and intervention status. We are essentially in level 1, which is called routine monitoring, and as members and the public can see in the executive summary there are 4 levels of monitoring set out by Welsh Government in the escalation and intervention arrangements, and just for completeness they're summarised there. So routine monitoring, which is the lowest level, the enhanced monitoring, which is currently what applies to us as a health board now for the 2023-24 year, and that's specifically in 2 areas. That's both planning and finance. We remain in routine arrangements for all other areas of the health board activity. Stage 3 is then targeted intervention. Stage 4 is special measures, and that is the highest level. And I've just put a summary at the bottom of the executive summary there in terms of what enhanced monitoring is summarised at. And essentially the words in bold there, it's really about demonstrating that we're taking a proactive response, and essentially means that aspects of monitoring are more frequent than what they would normally be for other areas. So this brief slideshow is really about providing you with an element of information in the full public domain, and also about giving you some assurance on the next 2 slides in relation to the internal governance arrangements. So Liz, if you could just flick on to the next slide, please. So what does enhanced monitoring mean in practice? Well, clearly it's significant, it's important, it's something that we've responded to absolutely in that vein and taken very seriously. From an external perspective, just to summarise how this has come about, so we received confirmation of the status of our monitoring from the Health and Social Services Minister on the 13th of September, and ordinarily that follows a number of tripartite meetings that are held by Welsh Government officials and other external regulators. We have had our initial meeting with Welsh Government to discuss that enhanced monitoring status, and we've had the opportunity to provide comment back on the terms of reference that will be reissued by Welsh Government shortly to confirm both the background, the implementation approach, and critically for the board, the whole board, the de-escalation criteria of what it would mean for Powys Health Board to be de-escalated from this status. In reality, it means that monitoring and contact meetings will be increased. That's particularly through the integrated quality and performance meetings, or IQPD for short. They were previously quarterly, they're now monthly. There is already also a series of director-to-director contact meetings in place, particularly for both planning and finance, that will also continue to happen on a monthly basis. Members will also be aware that we have joint executive team meetings, or JET meetings, with Welsh Government. They have always happened on a biannual basis, and they will remain on a biannual basis moving forwards as well. From an internal perspective, not all as a result of enhanced monitoring, but just to summarise the work that we've been doing as a board and as an executive team. So, of course, there was an immediate response from the Chair, Chief Executive and the executive team to make sure that we'd received and understood that information. We immediately updated and briefed the board to make sure that information was communicated in relation to our enhanced monitoring level. As Hayley referred to in her Chief Executive report earlier on, the Executive Committee has reviewed its subgroup structure to make sure that we've got absolute focus and efficient governance and assurance in relation to all areas of the Executive Committee's responsibilities, but particularly in relation to planning and finance. We had already, as a board, earlier in the year, taken a decision to increase the frequency of our Delivery and Performance Committee. That had moved from quarterly to bi-monthly, and that's a key committee in the context of providing assurance to the board in this area. And as again, Carl, you referred to in your chair's report earlier, we have got an IM vacancy in finance at the moment. That request is currently with Welsh Government to get out to live recruitment. In the meantime, we've taken our own steps and we've co-opted a finance advisor to both the Delivery and Performance Committee and the Audit and Risk Assurance Committees. So that's not a board member, that is somebody that can provide some additional support and specialist advice to both the committee and of course supporting Pete in his role as our Director of Finance. And then the last slide, Liz, if you would just flick on. So just in terms of assurance arrangements, I'm trying to summarise those for the board. So clearly the Executive Committee under Hayley's leadership as our Chief Executive and Accountable Officer will continue to lead the executive-led scrutiny and assurance in this area. The Delivery and Performance Committee, which is obviously chaired by and made up of independent members, will continue to lead the board committee scrutiny assurance. Both of those will obviously be received as reports back to the board at each of its meetings, and also suggesting that we consider a biannual report directly to the board that particularly focuses on the de-escalation criteria. And I think that frequency is in line with some of the key messages from Hayley and Pete earlier on, that this is both an in-year issue but also a future year issue and from a financial challenging perspective. And then finally, externally, so as I said earlier, Welsh Government will continue to lead their monitoring approach through the increased frequency of the monthly IQPD meetings, the Integrated Quality Performance Delivery meeting. The Joint Executive Team will continue, and the profession-to-profession discussions will continue as planned as well. We also, of course, as a board, will receive our structured assessment report that won't specifically comment on escalated status, but will comment on our governance, finance and planning arrangements within the Health Board, and that's an important source of assurance for the Audit Committee and the board itself. And of course, we'll continue to implement our internal audit reports and plan as well. So, Carly, I hope that just provides a bit of a summary of where we are and why, but also what it is that we've put in place and the recommendations to the board, particularly on this slide in terms of assurance arrangements moving forwards. Thank you.
Thank you, Helen. No, it's very helpful and concise summary. I've got a couple of people wanting to come in. Hayley, I'm very aware that these this kind of escalated arrangements place greater demands on you and your executive colleagues. I just wondered whether you had an observation as to what that feels like, how it's being managed, and so on. And then I'll come to Ian.
Yeah, thank you. Well, the first thing to say is that, you know, it's really important that as an executive team, we've taken that collective space of leading the enhanced monitoring interface with Welsh Government at a director level, and that's in part to demonstrate to Welsh Government grip, control and leadership, but also to try and minimise the broader impact of this additional interface with the wider organisation. I think we've had our first meeting, and I think that when we get the terms of reference agreed and we have got clarity on the de-escalation criteria, I think that will be an important part of discussion within the board to discuss the de-escalation criteria. So from my perspective, in any case, I think we have taken full control of the situation from the point of view of our preparation. We put a lot of effort into these meetings, and that's partly about giving assurances, not just in the planning and finance space, but also I appreciate we've only just in those two areas had enhanced monitoring status, but it's also about being able to demonstrate the continued focus on other priorities and performance and ministerial targets. So, you know, the key issue for me is getting clarity on the de-escalation criteria. I'm really keen, and I know we all are as a board, to get ourselves back into routine status as quickly as possible. So I'm very clear that that's part of the first conversation we need to get completely straight, which is what are the I guess indicators that we need to meet in order to de-escalate back to routine status, because it does take capacity to shift the intensity of the interface that we're currently working to, but we're trying to keep that impact at an executive level rather than the broader organisation. Thanks, Carl.
Thank you. Ian, please.
Thanks, and thanks. Appreciate those comments, Hayley, and all the hard work that's been undertaken to keep a grip on the situation. I just wondered, in terms of that enhanced monitoring, the context, it seems to me, is really important here, and maybe some words on the fact that we are not alone as a body. You've outlined the scenario and the approach, the proactive approach that we've taken as a board. But I think just a couple of words on the context of the pressures the whole of NHS Wales are under, and what is the experience of other health boards at the moment with regard to monitoring is important, so that we see ourselves within that wider context.
Thank you, Ian. Hayley?
Yeah, thank you. Well, absolutely. And I think that it's hard to draw comparisons about other health boards and you know, it was a step up for us to move from routine to enhanced, but clearly organisations are still managing both special measures and targeted intervention levels of escalation. So, you know, I think that my experience around this is to make sure that, yes, we're all in this together, and we do need to collectively as NHS Wales across the whole of Wales to reduce the escalation of each of the organisations. And clearly for us as a provider, we're really interested in that from a commissioning perspective as well, because we're looking at it from a commissioning assurance point of view as well. But I think for us in particular, just making sure that this is a very recent development for us, Ian. We haven't been in escalation before, so possibly for other organisations who've had more experience in handling that, it feels a little bit different. But you know, my key issue and another organisation which is in a similar position as us, which has moved from routine to enhanced, both organisations, I speak to the chief exec regularly, we trying our best to get back into the routine space, and what does that take, and being clear that those parameters are crystal clear to the board so that we can be held to account for meeting those requirements. And as I said, we've only had first meeting, but hopefully the second meeting we'll be able to get clarity on that de-escalation criteria.
Thank you, Hayley.
Thank you. No one else is indicating that they want to contribute, so thank you, Helen, Hayley, and indeed everyone, and particularly our exec colleagues for the way in which this has been responded to and is being handled clearly in collaboration and cooperation with others. So that's much appreciated. I mean, the recommendation per se is that we receive this as assurance. So we need to ask ourselves, are we assured by the information and the update that we have received? I'll take it that we are, unless anyone would like to indicate to the contrary. Then that is therefore supported unanimously, and we are assured by that information and that report. Thank you. We turn to 3.2 on our agenda and to the month 7 financial performance report. And we're going to Pete as our Director of Finance, Deputy CEO, and also Director of Information and IT. Thank you, Pete.
Yeah, thank you, Carl. So we've touched on the month 7 financial position earlier on in the agenda, so I'll take us through at a relatively high level and then welcome any questions and comments. So as previously explained, we've allocated the additional funding that we've received against our financial plan. So as at month 7, we have an overspend of 9.138 million, and that's against our revised plan deficit of 8.851 million. As a reminder, this is in relation to our revised plan against the 15.2 million before the further additional improvements that we talked about earlier. And that gives us an operational overspend of 287,000, which was the 300,000 pounds I referred to earlier. In relation to capital, we're on track to deliver against our capital resource limit of 3.6 million. Just to pick up on the key cost drivers within our position, included in the report is a section on our health board agency spend. We continue to see pressure in this area. We know that our agency spend relates to a number of vacancies and other factors within the position. Just want to highlight this is an area of focus and action within the health board. As stated in the further opportunities, it's an area we can reduce our spend, which will help us to deliver our control total. And I also referenced earlier that our spend in relation to mental health is an area we're focusing on at the moment, because that spend has increased significantly comparing year-on-year positions. Also included is in our, as always, is a commissioning position. This accounts for 40% of our total expenditure, so is a key financial area for our focus. We do continue to see pressure in this area, That's linked partly to not delivering some of the improvements that we targeted, but also in relation to increased emergency activity. And as described earlier, the number of actions we're taking to improve in that area, which become part of our plan to meet our control total. Also included in the report is a significant area of spend in relation to prescribing. This again is a key pressure area linked into primary care prescribing, but also an area of focused activity where we have delivered a number of significant savings, but even with that delivery, we're still seeing a pressure and a reported forecast overspend of 1.3 million in this area. Usual analysis also included in relation to CHC, our continuing healthcare and complex care, and it's worth just highlighting that our current forecast for spend in this area, included funded nursing care, is a total of just 29.2 million. So we're spending circa 30 million in this area. I think it brings a bit of context to an earlier question we had around a level of savings targeted in this area. So 100,000 against 30 million is not a huge significant ask, and it is relatively should be achievable. Also included is our savings programme. I just want to highlight that we set in our original plan, we had a target 7.5 million. Currently, we have green and amber schemes at total 8.4 million, which clearly is exceeding that 7.5 million target. That is what has given us that level of confidence to deliver against our original deficit plan. That position is prior to the additional actions that we talked about earlier, but it is worth pausing on that to recognise that is really helping our plan. The fact that we've got over the target means that there's a contingency, a bit of covering of slippage, etc. So it's really important. I think the other point I just wanted to reference is included in the summary section that basically, given the fact that we're forecasting a deficit position, that has resulted in the required to trigger the letter, as Helen referenced, in terms of strategic cash support, and that is to provide the cash for us to meet our ongoing commitments and payments as we move towards the end of the financial year, given that we're in a financial deficit. They're really the key points I wanted to get across. Carl, happy to take any questions or comments. Thank you.
Thank you, Pete. Just before we go to Kirsty, could you remind me, Pete, has this report been considered by any of our committees to date, or is it it hasn't? That's fine. Had it, I would have invited the committee chairs to comment, but that's absolutely fine. Kirsty, please.
Thank you very much, Pete, for the update. Could I look at some of those areas that are presenting us with the biggest challenge? So mental health. So we're quite used, aren't we, to seeing the continuing healthcare and the agency spend appearing on our list of, seemingly intractable problems. I wonder if you could give us a bit more detail on what is driving that cost in mental health and how we can look to recover that situation, and whether some of the national work that I understand is going on may prove to be helpful to us. And secondly, on prescribing, again, like everything else in our lives, prescribing is been hit by inflationary pressures, but we also do seem to have a rise in items being prescribed. Earlier, we talked about pressures in the medicine management team, doing loads of work, and as you said, already been able to save some money. But I'm just wondering again about realistically our ability to bring that back in, and whether some of that increase in prescribing is a result of delays in accessing secondary care. So if people can't get into secondary care, for instance, for a procedure, they're being managed in the community, sometimes with perhaps additional pain medication to be able to keep them as comfortable as possible while they wait. But whether we might see a decrease in prescribing pressures if we're able to expedite people's treatment.
Yeah, thanks, Kirsty. If I give a comment, and then I think Kate will come in and help with some of those questions around the medicine side. I think with this is a bit of a general statement, but in health, we know how dynamic the system is and how we we're constantly facing pressures in terms of inflation, in terms of availability of staff to fill our vacancies. So it's always a challenge. And I think as a general response, we need to make sure we're doing everything we can to be as efficient as possible in those areas. So in terms of mental health and the agency position, we know we've had pressures in terms of vacancies. We know we've had pressures in terms of individual care, where there be maybe additional care and one-to-one care needed for people. So our priority is always providing the best care possible. And then it's how we do that. So if it's using agency, can we look for a different way of providing that with more affordable agencies, or can we get additional people onto the bank? So there's those sort of steps we go through to minimise the impact of needing to continue to provide that care. And similarly, in terms of medicines management, and Kate will come in, we know that the team do a lot of good work in terms of where we can use biosimilars and other drugs which provide the same sort of outcome, but for less cost. So we're constantly looking at those things. So it's a challenge always, the inflationary and demand pressure versus what we can do to contain that. And it's something that we're always managing again with our risks and opportunities. And that's why I always reference that within the plan. Again, I'm being general because we're always trying to maintain that balance to deliver the position as we need to. So if I pause there and let Kate come in on the medicine side of things. Thank you, Kate.
Yeah, thank you. So in terms of the medicines, and the medicines management team working collaboratively with primary care, have had a really comprehensive efficiencies plan going for some time now, which really carefully looks at any opportunity and is working through it. There's a regular loop of feedback to primary care and the teams to try and make sure we are managing the medicines as best we can and gaining the efficiencies. Again, to just emphasise again that this isn't just about money. Often this is about good practice and better prescribing, so better for patients. So that's already going on. Recognising that this is incredibly important, then we've strengthened that or just provided a little bit of additional support in just making sure that where we can see that we're maybe not making the progress of having the impact we want, then just trying to put some support in, then we can work more closely with the primary care team. But I have to say that what we've seen is really, really strong engagement. I think everybody understands how important it is, and so both the primary care clinicians and the primary care management teams are working hard to make sure we deliver as best we can. There are challenges in that we've got medicine shortages, which is difficult. That creates extra work in having to change medicines and make sure we've got that right. It also incurs extra costs. So that is undoubtedly an issue and that's ongoing, but I know that we're very much linked into the national work as well, making sure we're aligned to what our sort of neighbouring health boards are doing, making sure we're sharing good practice. In terms of the secondary care impact, then there's a strong sense that that is the case. I've asked for some data to see if we can evidence that. It's actually incredibly hard to get, but what I can say is that anecdotally, then talking to the clinicians, then certainly I'm sure we have some pain relief prescribing, which is because people are on long waiting lists. So I think it's what I can say is there's absolutely awareness of it. And the clinicians are aware of the problems and are doing their best not to prescribe, but I have a strong sense that sometimes they have little choice. And then just finally, in terms of we know that there are opportunities there in terms of the biosimilar medications. That work has been ongoing on the health board for some time, and we're working hard with both our provider service and the commissioning services to make sure that we make sure that patients are on the very best medications for them, and the biosimilars are really important there. So yeah, so just summarise, it's work that's been ongoing, but we're really strengthening it and just making sure we've got as much support as we can in for the teams.
Kirsty, you content? Would you like to? No? Yeah,
yes, that's fine, thank you.
Thank you. Ronnie, would you like to come in, please?
Thank you, Chair. I suppose in a sense I would like, Pete, with your forbearance, to return to Kirsty's original question, and that's of pay budgets driven by the use of agency, both on and off contract suppliers. And we keep being told that this is an area of focus for all of you. And I have no doubt that that is the truth, and everyone is doing their level best to control it. But somehow we just lack the ability to get on top of it. And we certainly are an outlier in respect of Wales. But I just wondered, are there any examples we could draw on from elsewhere nationally, perhaps thinking of similar rural areas in England, which have a similar problem and which have managed to get on top of their variable pay in a way that we haven't? I suppose I'm just saying, are there any exemplars of good practice we can draw on from elsewhere? Thank you.
Pete, please.
Yeah, I can comment. Thanks, Ronnie, and Deb may want to come in as well. I mean, there's it's a multi-layered action plan in this area. Obviously, step one is to fill our vacancies, then we don't require agency. That doesn't mean it's never the case, because there may be operational pressures and other demands which mean that increased care is needed. And I think that what our focus is on from the basic level, that we've got efficient and effective rostering, that we've got a recruitment plan, and we know that that's an action area for us in terms of overseas nursing recruitment and other actions to improve our retention and to improve our numbers and our recruitment process. And it's a layer of action in all areas. Then it's moving up to, so if you cannot provide other temporary cover and you need agency, to make sure that we're using agency at the best possible price, and that being on contract rather than on contract, as you say. And I think that we are looking sort of nationally, because it's a national, one of the Welsh Government national programmes, looking at pay, looking at how we can get the best values from agency if we need it, but also reduce that need for agency. So we do look at others, Ronnie, and that's not to say we can't look at more again to learn any sort of opportunities that will help us. But generally, yeah, so we are attacking this at all levels to try and ensure that we get to the lowest level possible. I'm not sure if Deb, you want to add anything to that, but thank you.
Thanks, Pete. You gave kind of quite a comprehensive summary, really, of everything that we're doing around this. I think, in short, Ronnie, there's no quick fix, and it was always going to be a steady set of activities, such as the scaling up of overseas nurses, of which we've now got 10. We're talking about another 4 or 6 coming in the next few months. The 22 healthcare support workers, the 22 aspiring nurses that are now healthcare support workers. And I've just had in the last few days the data of agency spend by ward, and I can see that those healthcare support workers are now resulting in a reduction there. The specialing and that additional support, I think, is an area that is particularly problematic for us by the nature of the patient and their presentations. But there isn't anything that I've seen from best practice with other health boards that isn't already contained in our action plan. I think this is just keeping going on all of those activities that are having impact, planning to scale up, again, the aspiring nurses and the overseas nurses next year at greater numbers than we've seen this year. And I suppose the added bit of focus will be retention. So retention for nursing and midwifery accounts for 25% of our turnover. There is a national nursing and midwifery retention plan for which we've been given a resource by HAW. So you will see quite a bit of activity around that, about how we encourage people to stay in the organisation as opposed to leave Powys.
Thank you. I'm going to invite Claire Roche to add a brief comment, and then we'll check that Ronnie is content with the response before moving on to Kate. Thank you, Claire.
Yeah, thank you, Chair, and I would confer with everything that Deborah has said, that in terms of our vacancy rates, you know, we are not an outlier in terms of other organisations. We work really closely with other organisations to be able to understand nationally how we build and sustain our national nursing workforce and what that means for the Powys nursing workforce. I also think it's really important to remember that actually professional judgment plays a huge role for nurses, and staffing is not a a continual black and white matter. The staffing will vary depending on the professional judgment of our nurses in a ward area. We use the word specialing quite a lot. Actually, I think that is a little bit misleading. It is the professional judgment about the level of nursing care required. Thank you.
Claire. Ronnie, are you content, or would you like to come back on any of that?
Perhaps I could just return to the last point made by Claire, and to confirm that I'm generally content. But Claire, I've looked at an RCN survey which was recently published on the degree to which nurses are expressing mental health concerns to that organisation, and the fact that that is as it were, a seriously upward trend. And, there are legitimate concerns around all of that, and not only in relation to nursing, but also in relation to medical workforce planning. So I think actually, there's a need to be deeply conscious of the fact that colleagues do need support in the trying situations that they're facing currently. Thank you.
Thank you. Claire, do you have a brief comment before we move to Kate?
Ronnie, I couldn't agree with you more. I think that is an extremely important point, and something that I know, I can see Deb nodding at me. I know that Deb is aligned in that. And I think this is why when we're talking about retention strategies, of which we have been, at the table nationally discussing with HEIW and others, that actually the well-being of our people is absolutely fundamental to that. Recognising that, I've been a nurse in midwife for a very long time. It is an incredibly rewarding career, and in my opinion, the best job ever. However, it's not without its challenges, it's not without its stressful moments, and anything that is rewarding on the flip side can be very, very challenging and demanding, and that's why there are many things happening in the Royal Colleges as well to support well-being. So a good example of that is the Care for You campaign and work that's been done by the Royal College of Midwives. So yeah, I'm completely with you. Recognising that it can be a tough gig sometimes is absolutely fundamental to us retaining our workforce and developing them, and then feeling that they are fulfilled.
Thank you. So we'll go to Kate, and then we'll conclude this item and go to the recommendation. Thank you, Kate.
Yeah, thank you. Really important discussion. So just following on from Claire's comments, first of all, then absolutely, and Ronnie, absolutely, I think this is probably, well, this is the most challenging time I think we've ever known in healthcare, and probably in the public sector. So across all the disciplines, I think it's challenging, and we are seeing evidence of stress and really difficulty dealing with very, very difficult situations. So really important that we support as much as we can. I think it's a challenge. Our challenge in Powys is that we've got lots of small sites and relatively remote working. So whilst every communities are fantastic places to work, then I think we need to recognise that we've got tiny teams and really work as hard as we can to provide the peer support, which is incredible, and mentorship, which is incredibly important. And so I hope that we're trying to do that. I'm sure there's more we can do. In terms of the sort of agency use, and we mentioned mental health earlier, but I think it counts across. Another issue we have is that we don't have economies of scale in our sites. Other hospitals and other health boards have large units where they can pull staff across. We've got tiny staff groups, and it means we've got less flexibility, which can be a challenge. But also the acuity. We know that the acuity of patients is rising. We've got more dependent patients, more dependent elderly people through the pandemic, which I think is driving some of it. In mental health, the acuity of patients is rising across the whole system, and we're seeing the same in Powys. So unfortunately, sometimes that means with all our best efforts, and there are huge efforts not to use agency because it's not efficient, and although agency staff can be excellent, it's still not, in my opinion, as safe as using our own staff. Then actually, in spite of best efforts, given the acuity of the people we're having to look after, then we often have to resort to agency, and it's the position we're in. So it is a major challenge, but one, again, it's about retention and it's about forward planning. We're doing a huge amount to work with the universities, really getting people training coming through to show them what a brilliant place communities are to work, because we know that people that are exposed to working in the communities will come back and work in the future.
Thank you, Kate. What I think is encouraging and intriguing actually is that our a financial report has sparked a conversation about people, and that is absolutely a good thing, because money is important, but it's not about the money. It's actually about how we use that money and how we manage it in our in our engagement with our support of staff and so on, and indeed in our services to and with patients. But yeah, interesting discussion. This is a financial performance report. I'll just, before I put the recommendation, I think it's worth noting that earlier on in our agenda today, we approved the revised financial forecast for 23-24, including the underlying deficit. So obviously that sets a certain context for this report, but we're asked to receive this financial report as an assurance that our organisation has effective financial monitoring and reporting mechanisms in place. Would you indicate if you don't support that recommendation? Then that is supported. Helen, I think you'd like to come in at this stage just before we move to the next item.
Thank you, Carl. Just to make board members aware, Joy Garfitt, our Executive Director of Operations, Community and Mental Health, has just had to step out of the meeting to take a phone call. So just to make you aware, she isn't with us just at the current time. Thank you.
Thank you, Helen. So we turn to the final item before lunch, which is item 3.3. We're going to go back to Steve, who's going to take us through and introduce the integrated performance report at month 6. Thank you, Steve.
Thank you, Chair. And yes, as described, this is the position to month 6, and it covers all aspects of our commissioned and provided services from all the providers, either in Paris, across Wales, or those in England. Some of the position is familiar to that I've previously reported. So from a commission perspective, it's still a very challenging position across our Welsh and English providers, particularly in the areas of cancer care, A&E, ambulance performance and planned care. And whilst there are a lot of initiatives being undertaken to improve performance, and some of that backed by additional funding, progress is extremely slow, and not at the standard that we would expect for our residents and indeed ourselves. On the more positive front, as a Paris provider arm, we have been able to make some key appointments into a number of roles, both in the delivery of planned care, so new theatre manager, for example, some clinical oversight for planned care, and also in the area where of Claire Madson's areas in therapies, again, some appointments to plug some vacancies, and we're now starting to see improved performance coming through as a result. Some of our own provider arm performance is challenged in a couple of key specialties, including general surgery, orthopedics, and some of the diagnostic modalities. But through our exception and escalation performance framework, we've been working with the service managers and the service leads in our own provider arm to get an understanding of when the performance will improve back to compliance, or certainly back on track to deliver the ministerial measures. So the final slide in the cover report just describes the performance as a provider within Paris against those ministerial measures. A number of targets are not being met at the moment, and 1 or 2 actually going in the wrong direction. But we've undertaken additional work with those service leads in the last couple of weeks, and some more this week. And you know, I guess there's an increasing confidence level that some of those indicators and trajectories will be improved upon in the last 5 months, despite some of the challenges that we've described from a workforce and finance perspective. So the plans are coming together for a number of those services to improve performance. So what we will do, Chair and colleagues, for the next report is provide a restated forecast outturn and delivery confidence, particularly for those ministerial measure trajectories. The cover report is supported by a very detailed performance report, and I'm happy to take questions against that report, and I may well need to draw in executive colleagues depending on the subject matter. Thank you.
Thank you, Steve. So we go now to Kirsty, and Kirsty, please.
Thank you, Chair, and thank you, Steve, very much, and I very much welcome the report and the announcement that we've been able to recruit into some really important positions, and that's making a difference to our performance. But in some of the appendices and some of the narratives, you once again draw our attention to the disparities in access for POWERS patients, depending on what pathway they are on. So if you're in the north and the east, you have a different access issue than if you're down in the southwest. Now, we know that previously we did not receive as much money as we had hoped for from Welsh Government in terms of their recovery money. Forgive me, that's not the official title for the money, but there was, and that money was, it seemed to me, diverted into health boards to tackle the longest waiters.
Yes.
How do we know that, having not had the money ourselves, that POWERS patients are able to benefit from that investment in other health boards to bring down their waiting times? So what kind of assurance can we have that POWERS patients, you know, are being seen in Abertawe, Bromagano's very long waits, for instance, and that that money is being, you know, all need is important, and I don't want to dismiss the need of people living within those health boards that need that service as well. But, you know, obviously our interest is here is making sure we get a good deal for our patients. What assurance can you give us around that?
Yeah, well, quite a lot actually, hopefully, Kirsty. I think we've got full visibility now on all patients waiting across Wales, so we know who's waiting, what for, where and how long. And across Wales, a lot of additional investment and resources being applied to that greater insight of reporting, and we receive those reports weekly. So at any point in time, we know some of those key variables. Alongside that, though, we've working with the Pete's team in the finance team, we've got a much better understanding now of the volume and value of activity being undertaken versus the money that we're actually spending. So each month we sit down as a team and review contract performance to see how that's getting on. And on your specific issue of the funding that we didn't receive, in terms of we didn't get our proportionate share, we got an allocation that was not based on our resident share, which most allocations are normally based upon. We've got a mechanism in place that we're just about to communicate with other health boards to ensure that we are either not to ensure that we're not being double charged for the activity, because arguably those other health boards have had a proportionate share of our funds, and I'm about to write to those health boards suggesting a mechanism by which we check on a monthly basis that factor, but also the what plans they've got in place to progress activity, to improve capacity, to improve access. Now, that is a challenge, as we've said earlier. You know, all the health boards in Wales and the English trusts are subject to that difficult financial outlook. So this won't be a quick fix. I'm afraid it's still going to take a number of years to improve performance and reduce that inequity that we experience for our Paris patients. But we fully understand the position, put it that way.
Kirsty?
Thank you. And Steve's obviously on it. I guess, Steve, the question is, when that mechanism is being deployed, how will that be reported back to members of the board? Will that go to performance committee as part of your integrated performance report and be able to demonstrate that we're getting our fair share of that money that went somewhere else?
It will. And one of the mitigating factors to get down to the control total of 12 million that Pete and Haley described earlier was a line that said 400,000. This exercise that I've just described to you, that is will be a large contributing factor to the delivery of that 400,000. So we can update through the finance report as well the success of that delivery or not.
Thank you.
Thank you.
So certainly an action, as it were, from our conversation is that will be included in the reports to DMP. So we go now to Robert, please.
Thanks, Steve. I'd just like to focus in on the long waits on the RTTs over 104 weeks. If you weight the patient numbers, the ratio actually between the Welsh providers and the English providers is 49-1. So currently the equivalent, if you weighted it to, would be about 490, just short of 500 waiters in the Welsh system over 104 weeks. So my question, first of all, is how long over 104 weeks? You know, if we've got people who are destined to wait 3 or 4 years, and obviously this will mainly affect people in Ystrad Ganlais. The trajectory does seem to be that this weight is coming down. I just wondered if you could provide any information to confirm that that is the case, and you know, these large numbers of very long waiters with all the anguish that involves, that they've got some kind of hope particularly from Swansea Bay. Thank you.
Yeah. So thank you, Robert, and yeah, really good question, and one that you know, reflects the seriousness of the position. So we have got patients waiting over 4, some at 5 years across some of our Welsh health providers. It's probably best if I produce a table with the bang up to date data, because it does change on a weekly basis. So there are long waits now. The very extreme long waiters, so that's patients waiting over 3 years, they are starting to come down in number across Wales, but the number of patients being added to the waiting list that are likely to go over a 2-year wait is currently increasing, not decreasing. So that's why it's going to take quite a while for the extreme long waiters to be eradicated in Wales. And similarly in England, whilst for Paris residents we've got very few patients waiting over 2 years. This report identifies 10 spinal patients up in Robert Jones. The number of patients waiting 52 weeks to 104, up to 104 weeks in the English providers is increasing. So what with the outlook for a challenging winter, some of the workforce challenges, some of the flow challenges, potential industrial action for doctors to come, you know, it's going to be quite difficult for that position, I believe, even within English Trust, to be maintained. I think it'll probably deteriorate as capacity becomes more pressured in the remaining 5 months. But we've got very close working relationships with all of those organisations, and we're working with them to understand what their capacity means for our Paris patients and the reduced wait times. But a challenging outlook.
Robert, I'm not sure how. Yeah, I mean, it's as you say, Steve. It's very, very difficult, isn't it? Robert, do you want to come back on any of that?
It's just it's a sober answer, but it's very clear. Thank you, Steve.
Thank you. Does anyone else want to contribute to the conversation in relation to the performance report? Doesn't seem so. Thank you, Steve, for a very, very comprehensive and helpful report, and the concise and I think very transparent way in which you've engaged with that discussion. Much appreciated. So the recommendation is that we discuss and note the content of the report, and that we are assured that the Health Board has systems in place to monitor performance and to respond to relevant issues within that performance position. Does anyone not support that recommendation? No, so that is once again supported unanimously, and which takes us to a lunch break, which I'm sure will be very, very welcome. So I'm going to suggest that we take half an hour for our lunch break, which means that we will reconvene at 1:25. Yes, bon appetit, and I look forward to seeing you in a few minutes. Thank you. Okay, well, I hope everyone had a chance to grab a quick lunch, and welcome back, Chris and all. So we reconvene our meeting and we turn our attention to item 3.4 on the agenda, which deals with the closure of the branch surgery at Gilwern. Just a reminder that we have taken the decision after a period of engagement and proper process to close this branch surgery, and so the item today is not about reopening that decision, but what we did was that we said that we wanted to keep this on the agenda so that we could assure ourselves that the plan of mitigations was having the impact that it is intended to have. And so that's the purpose of this item. Pete is with us as our Director of Primary Care, and also I think Adrian is with us as our Assistant Director of Engagement and Communications. So over to you first, Pete. Thank you.
Yeah, thank you, Carl. And as you've just introduced, this has been a regular item on our board agenda. The update in terms of the mitigation plan is in the same format as previous papers, as is the supporting plan, which is included as an appendice. So really, I was just going to give a couple of key highlights from progress as we get close to the closure date. So number one being that a community wellbeing and information event took place at Gilwern Community Hall on the 3rd of November. That was to outline the services and care provision in the area to residents, and approximately 30 local people attended. A letter has been distributed to all households of registered patients in the Gwent area of the practice, confirming that the closure is taking place on the 30th of November. The regular meetings with the local community transport providers are ongoing, and these meetings will continue post the 30th of November just to check on what the impact has been, has there been any significant changes, etc. And those changes in practice registration continue to be monitored, and they will be kept under review post the closure date, just again to understand and make sure that if there are any other actions needed, they will be taken. If I just refer to the mitigation plan, which is included in full detail as an appendice within the board papers, you will note that a number of the action areas have now been closed, as you would expect as we near the closure date, but also those areas which I've just referenced that will continue to be reviewed on an ongoing basis post the closure. I wasn't intending to go through that in a lot of detail, but then just to say that the next meeting of the Task and Finish group is arranged for the 5th of December, and a further meeting on the 9th of January, when obviously we will be reviewing the plan, reviewing those areas I've highlighted for any sort of unexpected movement or changes. And that's really the basis of the update. Happy to open up then for any further comments or questions.
Thank you, Pete. Adrian, do you have any additional comments before we go to general discussion?
He's covered that all very well, and clearly also as highlighted in the report, we are planning for a further update on progress to the next meeting of the board, and that'll provide a really timely opportunity to review the frequency and requirement for any further reports going forward after that date.
Thank you. And Katie, I just wondered from a Llais perspective whether you'd like to come in with an observation at this point.
Yes, thank you, Chair. I've been sitting on the Task and Finish group, and I think there's a huge amount of work that's been undertaken. We've raised a couple of issues which have been listened to and taken forward, so I'm very grateful for that. I think for me, the proof will be in the pudding, given that the decision has been taken. So the process in effect actually starts on the 30th of November. It doesn't end on the 30th of November. So from our perspective, we'll be wanting to just keep a very close eye on what happens from the 1st of December, really, and how the changes and the plan are actually impacting on the patients of Gilwern. It's very likely that we will go back into Gilwern and perhaps do a community event sort of halfway through next year, spring, early summer, I would imagine, just to get a feel for for how the community has adapted and whether there are any further issues or concerns with the mitigation plan. Thank you, Chair.
Thank you. Does anyone else want to comment or contribute to the discussion in relation to the mitigation plan associated with the Gilwen branch closure? No, I can't see anyone indicating that they'd like to contribute. So thank you to Pete, Adrian and to Katie. The recommendation is that we receive the update on the mitigation plan and that we are assured in relation to the progress being made and on the further development and delivery of the mitigation plan. Please indicate in the chat function if you're unhappy to support that recommendation. In which case, nobody's indicated, so we support that unanimously. Thank you. Item 3.5, we turn our attention to the winter resilience plan, and we go now back to Steve, who's going to take us through this item. Thank you, Steve.
Thank you, Chair. So this is a system resilience winter plan that picks up not only the actions that we need to take as a health board, but in that wider system space, both within Paris and across the other health boards and English trusts that we commission from. So it's a very good practice to have a winter plan. And so we've compiled one with our system partners. So it has been developed with Regional Partnership Board and wider partners in Paris. There is no separate financial allocation this year, and sometimes that does drive the production of a winter plan, but we've done a winter plan because it's good practice to do so. But as I say, no separate financial allocation this year. So the plan brings together a number of component parts. And really, although it is a plan, the success and the delivery needs to be managed on a daily basis, because there are a number of key challenges that the system is experiencing, as we've mentioned this morning. And so it's really important that we ensure that this is a live document, live plan, and the communication, particularly between Paris Region Health Board and Paris County Council, so that's operational interface between Joy's team and Nina's team, is absolutely key in determining whether this plan is successful or not. The detailed presentation that comes alongside the cover paper covers such things as our approach to respiratory health and vaccination, our response to urgent and emergency care, primary care, system capacity from both a health and adult social care perspective. If we do need to escalate into surge capacity, a bed plan and so on and so forth, that is also covered. And if that daily rhythm is failing to keep up to date with the demands of the system, the winter plan goes on to say that we can escalate it through a variety of mechanisms available to the health board or the system at large. Welsh Government is also increasing their oversight in this area, so additional layer of infrastructure has gone in, which Mez is going to comment upon shortly. But as I say, it is a plan. The real test, though, will be that daily operational deployment of resources across the winter period, rather than the actual plan itself. So I'll pause there, Chair, and just invite Mez to come in on some of the additional work prompted by Welsh Government. Thank you.
Okay. Thank you, Steve. Diolch. So in terms of systems pressure, as Steve says, the plan is there, but in terms of major systems pressure, a number of sort of areas, notwithstanding, we've just come over a wave of COVID, but we're expecting another wave to come through during winter. And obviously, we're just pre the respiratory infections as well, in terms of flu cases starting to rise, as well as the pressures across the systems in terms of hospitals and secondary care. And then Welsh Government have stood up a planning and response group to look at system pressures, and both Steve and I are sitting on that, and there'll be a number of subgroups as well to look at pressures across the system, including industrial actions, which are in the planning as well, and looking at how we respond to that. But happy to take any questions, like Steve, I'm sure.
Thank you, Mez. Just before we come to Kirsty, it might be that Kirsty, you can respond to this yourself. You're absolutely right, Steve. And clearly, you're right. You know, in terms of no dedicated additional funding. Am I right in thinking that there is a kind of expectation on behalf of Welsh Government that the further faster funds will be used to support us in implementing the plans? And I just wondered kind of where we were in relation to decisions as for the use of those funds within Powys. Just thought it might be helpful to include that. But I'll go to Kirsty, who of course is also chair of the RPB. Thank you, Kirsty.
Thank you, Carl. There's actually been some further correspondence from Nick Wood at Welsh Government that arrived yesterday that referenced some of these questions and highlighted priorities. A lot of emphasis in that letter from Nick Wood yesterday was around improving system flow by reducing delays in assessment. And I wonder, I know in the past that people have felt that delays in assessment, or a focus on delays in assessment, isn't the answer to and people have been sceptical about the impact that will have. But nonetheless, given the Welsh Government's emphasis on delays in assessment, I wonder whether we could have an update on where we are with trusted assessor models and how we plan, referencing the work that Steve said is happening between us and Powys County Council to reduce delays in assessment.
Thank you. Steve, would you like to answer that, or any of your exec colleagues better placed to come in? I see Joy.
So we have received some funding, an allocation of 349,000, and that's going via the RPB, and we're in the process of putting bids against it to make best use of it, as you say.
Yeah, if I jump in and
please, Joy. Yeah.
Okay. So in terms of further faster, we're particularly looking at sort of capacity supporting district nurses with healthcare support workers to extend their reach and capacity, but also investing in some anticipatory care pilots on top of what we've already been doing. I think it's important to note that further faster, we shouldn't just see it in isolation. It's a fund which enables the 6 goals for emergency care and also the 5 goals around planned care, so it should be seen in the round. In terms of delays in assessment, your question's really timely, Kirsty, because I had a 6 goals quarterly meeting where we were as a Powys team on 6 goals only this week. So what we've seen through some of the trusted assessor work, but also getting our house in order about timely assessment, timely planning of assessments coming through the pipeline, we've essentially seen a delay, and the delay reduce in times for assessment. But what we're seeing is because we're doing the assessments quicker, we're being more prudent about how we do the assessments and generally more organised from an operational perspective. What we're seeing then is a delay in the time it's taking to commission packages of care. So real challenges, particularly around areas of Powys in dom care and residential nursing care. And it isn't a uniform picture across Powys, but we're seeing a move. If you can do one part of the system quicker, what we're not being able to do quicker is the expansion of the private sector market in order to be able to respond and meet the needs of Powys residents. So that's the challenge for us.
Kirsty, would you like to offer additional comment?
No, thank you. Just to say that the RPB meeting was delayed and will take place shortly, and I'm anticipating that the RPB executive group or the Pan Cluster Planning Group will be able to make recommendations to the board at that point around the allocation of the money. So that meeting was delayed from the end of November to the first week of December. So that will allow the group to come forward with recommendations. The group has already decided, just for information for colleagues, the group has already made a recommendation that any underspend, and perhaps Hayley will refer to this later on in the partnership report, any underspend of existing RPB money will also be used to support winter pressures. So as Joy said, it's not just for the faster money that's going to support some of the winter activity, but the RPB has already had a recommendation that any underspend be deployed to support these activities also.
Thank you. Does anyone? Oh, Hayley, please.
Yeah, just to respond, Kirsty, to your point, the RPB Executive Group is meeting Monday, ready for the Regional Partnership Board to receive the detailed proposals. Yeah, I mean, I think the context of this as well, I think it's really important that sometimes we get very specific focus on individual pots of funding, and we need to look at the overall deployment of the winter plan in this context and how we will manage that across the whole system. So it's how that whole picture looks like, which is where we are with a sort of, I guess, composite winter plan. But clearly the priority for us when we are looking at those investment decisions in the Regional Partnership Board is to have immediate impact on action, and that's what we'll be seeking to get assurance from through the proposals that are being presented.
Thank you, Hayley. And we'll go to Ronnie next, please.
Thank you. I wanted to pick up the issues around respiratory health and vaccination and infection prevention and control. And I think in relation to those particular aspects and preparing for what may face us, I like to think of this as a kind of battle rhythm. And, you know, we have the opportunity to increase or decrease the battle rhythm depending on what's happening in terms of actions that are specifically required. And what I have no sense of, Mez, I suppose this question is directed to you, is how sensitive we are, how sensitive is that system to the need to crank it up, or in fact to lever it down slightly? Thank you.
Yeah, thank you. So in terms of, respiratory infections, so we've got the respiratory vaccination programme that's currently delivered around flu and COVID. And to give you assurance that around COVID vaccinations, everybody that is eligible will receive an appointment for vaccinations by mid-December, in line with the request from Welsh Government, and likewise with flu through primary care. In terms of surge planning, we do have a surge plan in place for vaccination, which we have exercised earlier on this year, and we have a joint oversight group with the local authority and Public Health Wales that we meet every 3 weeks. So we continue to test as well for respiratory infections for vulnerable groups, which is technically for us in Powys mainly care homes, and we do have plans in place that should we need to increase in terms of contact tracing and testing, that we're able to do within a COVID stable. So you'll be aware that funding for TTP was reduced drastically, and we are doing testing and contact tracing for vulnerable people, but we do have some contingency to be able to step up within a COVID stable scenario.
Thank you. Ronnie, would you like to come back in, or are you okay?
No, that's fine. I was just seeking assurance on the point, Carl. Thank you.
Thank you. And Claire, please comment.
Yeah, thank you, Chair. I suppose I just wanted to add to that, Ronnie, in terms of what Mez provided that update, but from an infection prevention and control perspective, we have an established infection prevention and control advisory group that consists of our consultant nurse for IPC, our microbiology lead, members of Mez's team, and that group meet very regularly, but it's also a very agile group. So actually, if there's new information coming to light, if there's new guidance, that actually they'll convene themselves really quickly to review that guidance, be able to consider it, and then provide a professional advice to myself, Mez, Kate and Claire as the sort of clinical directors in the organisation, and we would seek then to be able to approve whatever communication goes out. So we're actually not relying on that, you know, always going to the executive team either, so that we can be really responsive in that battle rhythm and be making sure that we respond.
Thank you, Claire. Steve.
Yes, thank you. Mez and I attended a newly formed Health and Social Care Services Group System Resilience Planning meeting this week. So it's been stood up by Welsh Government. It will meet weekly, and Ronnie discussed that very item and that narrative around battle rhythm. And the whole point of it is to try and manage those concurrent risks and look at a 4 or probably 8 week forward plan to try and mitigate some of these risks. So as well as our local actions, Welsh Gov has stepped into this space also. Thank you.
Thank you. Does anyone else want to contribute, please? No? Okay. Well, thank you very much. So we are asked in the recommendation to declare that we are assured as a board that an effective system resilience winter plan is in place for the 23-24 winter season. Please indicate, as before, if you're not content to support that recommendation. Then once again, that's supported unanimously. Thank you. So we go on to item 3.6 of our agenda, and the assurance reports from the various board partnership arrangements that we have, but we have a particular emphasis, if you like, in this meeting on the regional partnership board, and we have additional and enhanced information as to the activity and effectiveness and so on of that particular partnership. So I'm going to go to Hayley, who's going to take us through this. Thank you, Hayley.
Thank you, Chair. Can I just check, Chair, did you want to pick up any other partnerships at the same time, or for me to start with the Regional Partnership Board?
If we start with the RPB, Hayley, and then we can go to the others afterwards, is that okay?
Yes, yeah, that's fine. I just I'm getting used to admin control,
That's
so I was
okay.
just finding myself in the right spot.
So
Lovely.
so sorry, it might be that the order of things in front of me is throwing you a little bit. So
no, it's all I can say, it's definitely user error on my part. So yeah, no, I'm really pleased. I mean, this is quite a detailed assurance update report to the board, and I'm very grateful to Joe Wellard and the regional partnership team for pulling this together for us today, because I think the regional partnership board is a really important part of our partnership landscape in Powys, but we felt it was important to bring that back to the board for assurance, both in terms of you understand and you have detail about the detailed work the Regional Partnership Board is taking forward, and also in particular a new piece of development, which is the work that's been undertaken regarding the Strategic Capital Plan. Currently, we know that Kirsty, our Vice Chair, is the Chair of the Regional Partnership Board, and I currently chair the RPB Executive Group, who sit underneath the Regional Partnership Board to develop proposals and recommendations for their consideration. So I'm not going to try and summarise the report. I'm pleased to be able to tell you that, but I did ask Wayne Tannehill to join, partly because I think a number of the aspects of this report we will be aware of. The fact that we refreshed the area plan, the fact that we've got a number of long-standing strategic partnerships across Powys in place, from Start Well, Live Well, the Mental Health Partnership, Age Well, the work on Workforce Futures, our North Powys Wellbeing Programme, Capital and Innovative Environments, and also the cross-cutting work that sits under Transforming in Partnership. You'll see from the report that we set out and give you the latest area plan summary and also details of how the resources that are allocated to the Regional Partnership Board for consideration and approval are currently being deployed across Powys. Really interesting to see those investment decisions that have been taken earlier in the year, and you know, a really important part of the activity of the RPB. I think particularly, I think that there's been a lot of strengthening work over the last few months around the engagement piece and also the performance and reporting requirements that sit within and support the work of the Regional Partnership Board, and really glad to see we've got some examples of some of the newsletters that have been shared as well. But I thought it was really important to sort of draw attention to the strategic capital plan. This was a specific piece of work that we were asked to deliver every regional partnership across Wales. It's been a substantial piece of work in looking at the assets across the whole of the partnership and how we can take that forward in Powys. And as I said, I'm really grateful to Wayne for stepping in and chairing the Innovative Environment Strategic Capital Planning work for and on behalf of the Regional Partnership Board. I don't know, Wayne, at that point whether you wanted to particularly say something about the Strategic Capital Plan, but I think it is a very comprehensive report. And I know you'd say this, but you know, it's a work in progress. It needs to constantly be updated to reflect the current position. Is there anything you wanted to add around the Strategic Capital Plan as introduction?
Yes, thank you, Hayley, and thank you, Chair. I think, Chair, you started off by saying you were seeking assurance about collaborative work in this particular area, and I think this is a really good example of that. The Strategic Capital Plan is a clear joint strategy that's been worked up between council colleagues and third sector, a lot of asset reviews across the sector, and I think this is also feeding in a timely fashion to some initiatives of the Welsh Government looking at estates rationalisation more generally as well. We can point to this in terms of exploring the opportunities for collaborative use of assets in public sector and third sector. So a really good piece of work. It's a 10-year plan. I think, as Hayley has indicated there, this is the first version of it. I think for anybody that's read it, it's quite a long document, and we'll look to really work on that to make it a bit more concise. But it's also a live document. And it just so happens, coincidentally, we've got a meeting with the Welsh Government leads for Housing with Care Fund and the Integrated Rebalancing Care and Capital Fund a little bit later this afternoon, where we're going through the Strategic Capital Plan, and particularly some of the feedback we've had, and excellent feedback we've had from stakeholders in the discussion. We're looking to develop some of the thinking and opportunities that have been highlighted with some external support, and we'll be exploring that with Welsh Government colleagues a little bit later this afternoon. So I think a really good piece of work setting us up for a joint strategic approach to our assets, looking to the future, and again referencing particularly things like the population needs analysis assessment, market stability report and the area plan.
Thank you, Wayne. And Chair, I think it would be remiss of me not to offer an opportunity for Kirsty, as Chair of the Regional Partnership Board, to perhaps add reflections or comments to the assurance report that has been developed.
Well, thank you, Hayley. Just like you, I'm very grateful to Joe for the work, and just like Wayne's capital report, I think we're in a stage of work in progress as well in the RPB in trying to get better reporting mechanisms and assurance mechanisms in place with regards to both capital and revenue spend, trying to communicate clearly about what the role of the RPB is and sometimes what it isn't, because sometimes there is a misunderstanding about what the RPB is and how it operates. So I think that's very welcome. But can I just say, you know, like Hayley, I just want to say a massive thank you to Wayne, who, bless him, didn't ask for this job, but has responded to the call of your RPB needs you. And, you know, we're just in such a better position than we were previously, and that's down to kind of Wayne's hard work and leadership. So hopefully some of the pitfalls that we fell into previously will be avoided. And I think what's different here is that capital is being seen as a strategic enabler, rather than just we'll bid for some money and we'll think about the service provision and I will run it after we've got the money. So, you know, making sure that this is a strategic approach to our capital to support service development and to help transform service is really welcome. But I think, Carl, from a board point of view, this is the first attempt to try and give more detail on the RPB, and that's been in response to members who've always felt a bit unsighted maybe on what the RPB is doing. So I think both Hayley and Joe and myself, who are kind of responsible for this report, would be very grateful for feedback. If this is the kind of thing that people find helpful to see, we can do more of it. But if there's stuff that's still missing, then we can try and address that as well.
Thank you, Kirsty and Wayne, Hayley, appreciated. And just to pick up on Kirsty's point, I certainly warmly welcome this report. RPBs have been in existence since 2008. They've just started their second 5-year planning period and of course set up by statute, but not an accountable body in and of themselves. And that's always created a bit of complexity around governance and accountability with such as health boards and local authorities and so on. And as Kirsty says, that sightedness. So absolutely, I think it's very, very welcome to see these reports, and so that we're aware as a board of the decisions taken and so on. I still think there's a little bit of work to do around strengthening those governance links, but I know that that is under consideration and being looked at. So thank you very much. Robert, please.
Thank you. Thanks, Chair. And I'd specifically like to ask Wayne about his document, the document produced on capital. And I'm going to concentrate on the decarbonisation route map, Wayne. I'm not going to ask you, I see here it says from 2022 to 2026, we should be well on our way. I'm not going to ask you whether we are well on our way. We'll leave that for another time. But how will decarbonisation appear in terms of process for the various organisations within this group? How is it that we are going to work together using the exemplar of decarbonisation to demonstrate how well we can achieve a goal jointly?
Yes, thank you, Robert. And I think it's a really important question around environment and decarbonisation considerations working towards the 2030 public sector carbon zero targets. So we've developed, and we're developing as part of the strengthening of governance, an opportunity investment tool that looks at a number of criteria when we're prioritising the projects that have come forward. And as you might expect, decarbonisation is one of those elements that we're looking to pick up and really add a weighting to in terms of the value of each of the schemes. And I think, as you're possibly aware, we are doing an awful lot in the collaborative space now, in terms of the North Powys project, where we're working together with, again, Council and Third Sector in terms of developing that net zero approach, with quite a lot of guidance coming out of Welsh Government at the moment that we're adhering to. And we're working very closely with Welsh Government Energy Service at the moment in terms of a general look at our assets across our estate as well. So I think a very active area, Robert, and I can assure you that it is something that we take very seriously in terms of this particular activity for capital.
Thank you, Wayne. Just to add then that for me, the important thing is that we're able to, let's say next year or the year after, we're able to point to the added value of working together as opposed to things which we could have achieved on our own. Thank you.
Thank you, Robert. Ian.
Thank you. Just a comment really on digital. It's just surprising to me to see conspicuous by its absence is infrastructure, because clearly infrastructure within Powys is a problem.
Wayne, would you like to respond to that, or?
Yeah, I think again we would recognise this as a really important element. I'll have a look back through the document to see in which way we've picked it up. I know again in the collaborative space for North Powys, for instance, the recent workshop focused on digital, and I know there's an awful lot of work going on in that particular sector. So I'll have a look at that, Ian, and come back to you if it needs strengthening in this document, and would value your sort of thoughts on that outside this meeting as well.
Thank you, Wayne.
Does anyone else want to come in? I can see that Nina has just joined us from Powys County Council. Nina, where I know that you were a bit delayed in joining. We're just discussing the RPB report at item 3.6 on our agenda, and well, perhaps particular emphasis on the capital strategy. But I just wondered, you know, because clearly the duty, the statutory duty in relation to the RPP is placed both on the Health Board and the local authority in different ways. But just wondered whether you had an observation to make about the RPB generally, and the direction that we're both taking it.
Thank you, Chair, and apologies, I had to drop out for a while to deal with an incident, so, and I have missed everything that Wayne has just been covering, so apologies, I'm speaking with no prior knowledge of what you've just discussed.
Absolutely fine.
Generally, in terms of, I think we're really making positive steps forwards in the RPB sphere in terms of governance, assurance, control, all of that, and that's how it feels from us as partners from Powys County Council. There's more work to do. There's always improvements and things we can strengthen, and I think we all acknowledge that as well, which is really important. But overall, Chair, I think we're moving in a positive direction and strengthening together in partnership.
Thank you very much, Nina. So I can't see anyone wanting to come in relation to the RPB reports. So thank you for those. And we go back to the other reports, Hayley, which I'm very happy for you to take in whichever order it suits you. And as I say, it's probably me that mixed up the order. So
no,
apologies for that.
It's absolutely fine. So the first report is around the Shared Services Partnership. I haven't attended that. Pete attends that on my behalf. You can take the report as read. I don't know if anybody wants to pick up any queries, perhaps at the end on any of these aspects might be helpful. Then the other issue is just to reference the Mid Wales Joint Committee, the Rural Health and Care Conference that took place. That was referenced and that was really positive, and we had some really good best practice shared through the two-day event, which was very helpful. And then just WISC, well, I say just WISC, it's really important work. The Welsh Health Specialised Services Committee report, the details contained within the report there, just to let you know, this covers the meeting that took place on the 19th of September. I was in a WISC meeting earlier in the week, and we have continued the discussions on the integrated commissioning plan is what I wanted to reference. There's still further work to be done on that in light of making sure that there's full alignment between the resource allocation discussions, which we will probably hear from Welsh Government potentially before Christmas, and how that fits in terms of the integrated commissioning plan for WISC, and the investment decisions for EASC as well, actually aligned with our development of our integrated medium-term plan for submission to Welsh Government. I guess the other issue just on EASC I wanted to particularly highlight in the report is, and clearly we will have further opportunities, again EASC met earlier this week as well, so this report covers the previous meeting. I just wanted to particularly draw out the opportunity that the board will have to discuss fully the work being taken forward for the EMIT service and around the air ambulance issues prior to the Emergency Ambulance Services Commissioning Board considering it. So I'll have a mandate that then going into that meeting based on a board discussion regarding the options and where we've got to with that. Those were the key matters I just wanted to highlight to the board, but I'm really happy to take any queries or comments or questions. Thank you.
Thank you, Hayley. Are there any comments or questions? No. So thank you very much for that. So we're asked to receive and note the updates contained in these reports in relation to the matters discussed and the matters agreed at recent Partnership Board meetings. That's the first recommendation. There's a second recommendation, particularly in relation to the RPB reports, and that's that we are assured that the Powys RPB has in place appropriate governance arrangements and engagement systems to deliver against the agreed joint partnership priorities that are set out in the joint area plan that we call our health and care strategy. And finally, that we are assured that the RPB's strategic capital plan is in place for Powys. Again, if there are any issues or any dissent from supporting that recommendation, would you please indicate? Therefore, that too is supported. Thank you. So we come now to 3.7 and the assurance report of joint committees. Back to you, Hayley.
Apologies, Chair.
Yeah, we just had these, haven't we?
Yeah. Are we on 3.8, which is the local partnership?
Yeah, that's right. Yeah. So sorry. I think we ended up merging. Yeah, I think we ended up merging those two two agenda items, didn't we? So
yeah,
which is
apologies.
absolutely fine. But just for clarity, then the comments from Hayley in relation to the joint committees that she shared with us at the end of the discussion that we just had, then the recommendation is that we note the updates in these reports in respect of the matters discussed and agreed at the joint committees. So again, does anyone want to indicate that they're not happy to support that recommendation? Thank you. So thank you for that, and apologies for the bit of a hiccup in relation to those two items. So we turn now to 3.8 and the local partnership forum, and we're going to Deb, our Director of Workforce and Organisational Development. Thank you, Deb.
Thanks, Chair. As we've seen in previous boards, what you have within the pack is a summary of the meeting and a kind of cover paper just setting out what was discussed at the meeting on the 2nd of October. I'll take it as read, and just to reassure, we always have good participation across a range of subjects at the local partnership forum, and I'm happy to take any comments or questions that colleagues might have. Thank you.
Thank you, Deb. Are there any comments or questions? I know that this is jointly chaired by Cathy, our independent member with a trade union background. So Cathy, I don't know whether you want to come in and offer any comment, or indeed any other board colleague, please do feel free to contribute.
No further comments, if I'm honest, Carl.
Okay, that's absolutely fine. So there is no contribution in relation to this item. Once again, we note the progress on sorry, I'm running ahead of myself now. It's recommended that the board receives and discusses the update report that we have in relation to the local partnership forum. Is anyone unhappy to support that recommendation? No, so that's supported. Thank you very much. And so we turn now back to Katie Blackburn, the Regional Director of Llais, for the Llais report. Thank you, Katie.
Diolch, Chair. I sent my report in, so I'm hoping everybody's had an opportunity to read it. I'm happy to take any questions, but I also just thought it might be useful just to pick up on one or two things, just to give members a bit more of a more recent update. We have now completed our deep dive, our hyperlocal visit to Builth Wells, which has been really interesting. So to remind members, we've now visited Welshpool, Ystrad Gunlais and Builth, and Llyn Idlwys will be the next locality that we will be visiting. Each one has been very different, as you would expect, and it's been a learning curve, but we've had some very, very rich data that's come out of it. I think the key for us is the so what key. You know, so what? And we're working closely with the Health Board and the local authorities to actually understand what we've heard and what that actually means. I think it's fair to say that in Powys, we're very much driving this hyper-local approach where we're looking at going to communities rather than expecting communities to come to us, and that's really worked well. In Builth, we were in the livestock market and we've done the school, and we're going to community groups that we've not touched before. So we're looking now, I think, after one of these deep dives, to having a workshop made up of local authority, health board, third sector representatives, including volunteers and perhaps the schools, to actually sit down and work through what we've actually heard and what the implications of that are. I think it goes back perhaps to Simon's very earlier point about how we get that sort of alignment to local level between local authority, health boards and other community groups. The reports, there are 7 reports now that we've undertaken. I'm very happy to share those with you if they haven't been shared. The reports that we've undertaken are currently going to the executive group, which reports into PESC. And I think the intention, although it's all evolving, is that those reports will be considered by PESC, or at least a summary will. I'm also providing a report for the Local Authority Scrutiny Committee with Nina and Lynette, and last Friday I presented to a development session of Powys County Councillors, and obviously, Chair, that offer is always open to you if you would like to take it up, but I appreciate the pressures that are on everybody's plates at the moment. I think the other thing that I would just pick up really is, Hayley's just touched on, well, they've been touched on throughout, is the number of service changes that we've got at the moment, which have an impact on Powys. So there's the Neville Hall Hospital MIU. Unfortunately, I wasn't able to go on Tuesday, Chris, but I'll pick that up. Robert's already referenced stroke. I have to say we are, and I know colleagues are getting increasingly concerned about the further travel that is becoming a risk, really, with stroke perhaps going to Cardiff and Worcester, and that the impact on Powys patients. So we're keeping a close eye on that. And the third one at the moment is the one that Hayley's just referred to, is the Wales Air Ambulance EMERT service. And I have to say, as Llais, as an organisation, not just in Powys, we were disappointed not to have been involved in the phase 2 engagement documentation. Our understanding had been that there would be a costed options appraisal that would be engaged upon. So we're currently in discussions with ESC and Stephen Harry as to how that can perhaps be shared. That additional information. So I think that's probably all from me, Carl, for now. Thank you.
Thank you, Katie. Just before I take other people's comments, just to say that, you know, acknowledging the very close and positive working relationship that there exists between the Health Board and Llais locally. Hayley and I recently met with the board and chief executive of Llais nationally and had a very constructive conversation. And it's probably worth mentioning that the micro local engagement that has been pioneered in Powys was absolutely recognised as good and innovative practice that other areas, I understand, are interested in learning from. So that was really helpful to hear. Certainly, your offer, as it were, of a development session, we're certainly looking at how we reshape and replan our development session content over the next year or so, and meeting with strategic partners and so on is going to be very much part of that. So thank you for that. That's helpful. And the last thing from me, and it may be that we need to take this outside the meeting, but I was interested to note that Llais has now appointed regional ambassadors, and that Grace Quantock, the Vice Chair, is the Powys ambassador. So perhaps a chat outside the meeting or something, Katie, would be helpful to understand what the particular role is and how, what kind of appropriate relationship we have with ambassadors as well. So, but just those few comments.
Thank you, Chair. I did touch on that last point with Hayley earlier in the week, so we'll work that through and come back to you.
Brilliant, thank you. Robert, please.
Yeah, thank you. I'm just going to refer to something that was in Katie's report on themes, and this was where GP Services Concerns Re-Behaviour Contract. Now, without knowing much about this raises all kinds of questions about equity, why some do this, and it might be contractual issues as well. I don't propose we discuss those in this meeting, but I'm wondering, Chair, whether this is something that could be explored outside the board without prejudice to what we found. I'm just wondering whether this might be considered by Kirsty's team, on the patient safety quality committee, if she's agreeable, and yourself, just to look at it to make sure there's nothing that we should be concerned about.
Thank you, Robert. I know Hayley wants to come in, so perhaps you might like to pick up that, Hayley, as well, and it may be that Katie might have a comment to make. Thank you, Hayley.
Yeah, thank you, Robert, for that comment, and just some reassurance, really. I'm assuming it's the same thing, but we'll discuss it outside, Katie. I think there's a general concern around perhaps how people are off-listed if their behaviour isn't appropriate in the primary care setting. I know I was in a public meeting fairly recently where I explained the process around that, and then the health board's involved and how we manage that. But I think it's a fair point, Robert, that providing some of that detail through to a committee would be helpful, so that there's an understanding around the process, but also the very limited numbers of cases that go through this process across the whole of Powys. So that's the first point. And just to clarify as well, Katie, that thematic analysis and the rich intelligence that you're pulling together, I think the home is the patient experience, quality and safety. And I know there's been discussions, as you've had more detailed with Adrian, about how we pull that together and get that reporting on a more systematic basis through to the committee. I think the two additional points I wanted to raise was that, and you mentioned them, your views around EMIS and Wales Air Ambulance. Obviously, as part of our board's consideration of our position on this, we would want to take due consideration of Llais and your position. So I think that proactive sharing of your views will be important, both to inform our board conversation, but also to help me in the Emergency Ambulance Services Committee context as well. So welcome a further conversation around that. And secondly, you mentioned stroke, and just wanted to sort of say, I know that our strategic change report that went to the planning, partnerships and Population Health Committee earlier. The last meeting that we had, the strategic change report was just mentioned. I've taken a particular action to pick up the conversation about what the national picture, including the cross-border picture, looks like from an acute stroke pathway point of view. So I hear your concerns, and I do share similar concerns. So we'll pick that up as an additional point of assurance and discussion when we next meet. Katie, thanks.
Thank you. Robert, Hayley's suggestion that the reporting and information that you were talking about goes to committee, which I presume will be PECS. Is that you content with that?
Yes, I am. Obviously, Kirsty would need to agree that as well.
Yeah, Kirsty, unfortunately, she was going to come in and contribute to this conversation. We just had a message from her to say that there's a fire alarm going off in the building that she's in. So quite rightly, she's had to leave us. So hopefully all is well, and she may or may not be able to join us before we finish this bit of our meeting. So I can't see anyone else indicating that they would like to contribute. So if there isn't, then we thank Katie for the report that we received for information. Thank you very much, Katie. So we go to the fourth section of our agenda, other matters for our attention, and to item 4.1, which is our board work programme. Back to you, Helen. Thank you.
Thank you, Carl. Not an awful lot to add. This is a rolling programme. The items highlighted in red are things that haven't been covered at a particular meeting and therefore picked up at a later one or elsewhere. Ian, thank you. You've helpfully just pointed out to me that there is an item missing in the March board in relation to the strategic digital framework. So, Carl, that's just an omission. We will make sure that that is added in. But this is set out in terms of meeting our standing orders and in terms of reference. But as always, is a rolling agenda programme as well. So any other comments from anybody would be very welcome, either in the meeting or outside as we continue to develop it. Thank you.
Thank you, Helen. So we take on board Ian's comment, and that will be included. Are there any other comments or questions even? No, so that's noted. That's there for information and comment. I'm not aware of any other business. Does anyone have any other business? No, in which case that concludes the business for our meeting in public. However, there is just an item that we need to deal with in private session, and just before we do that, then we need to consider emotion in order for us to meet in private session, which I will read out. That representatives of the press and other members of the public shall be excluded from the remainder of this meeting, having regard to the confidential nature of the business to be transacted, publicity on which would be prejudicial to the public interest. So again, would you please indicate if you don't support or agree to that motion? So that is passed. This meeting therefore is closed, and we will reconvene in private session. We're due to reconvene at 2:45. So yeah, let's do that. Let's take 20 minutes and reconvene at 2:45 in committee. But for now, thank you all very, very much, and particularly can I just express deep appreciation for all the work that goes into preparing for not just yes, a board meeting, but lots of other stuff as well. And so to everyone that's prepared papers, to Helen, to Liz and the team, and who've done a sterling work, and the quality of the information that comes to us and the accessibility of that information is much, much appreciated, and actually enables us as a board to carry out and fulfil our responsibilities effectively. So thank you very much for that. So we close the meeting. We'll meet in private session at 2:45. Diolch yn galon.